Tak dobrý den, dámy a pánové.
Hello, ladies and gentlemen. Allow me to welcome you to our today's conference that's called It's Time to Cooperate, which is organized by the MP Margita Balaštíková, that is me, and my colleague, member of the Senate, Mr. Herbert Pavera, together with the TCIM and the Ministry of Health. The organization is held under the aegis of the Minister of Health, Mr. Válek. And let me now hand over to Mr. Pavera. Very good morning, ladies and gentlemen. I'm glad that after many years we are having an interesting conference on alternative medicine. For years, everyone wanted the Ministry of Health to consider the ideas of alternative medicine as a possibility and room for further treatment of patients. And thanks to the commission headed by Mr. Fiala and thanks to my colleague, Ms. Balaštíková, the committee attended a number of problems and we also prepared this conference. Thank you all. And thank you, Ms. Balaštíková and her team for organizing this event. And let me thank all presenters for their contributions, for their wise contributions that will hopefully convince the Ministry of Health to take into account our comments. It's time to cooperate, and I believe that this is what's going to happen. Not tomorrow, not the day after tomorrow. The alternative medicine will not be immediately included in therapeutical methods supported by health insurance companies, but we talked to Mr. Fiala and together with Mr. Pfeiffer, we believe that it might happen in a few years. I'm very optimistic. Margita Balaštíková, thank you, and I wish you a successful conference. Well, before I hand over to the chief moderator, who's Mr. Fiala, I'd like to explain that the conference is streamed on the website of the Parliament, and the recording will be available on the website of the Parliament, and simultaneous interpretation is available. Please use the headsets if you want to listen to the interpretation. Every presenter will have 15 minutes that will be monitored at the rostrum and can receive 3 more minutes. So I hope you to adhere to the time schedule. Well, this conference will be very busy and I hope we'll be able to use our time. We have no breaks, and if you need to leave the room, you'll find the restrooms in the corridor, and there's some refreshment available for you. Please don't take it inside. No liquids, no food. And here at the door, you've got papers for you, and please write down your questions for the presenters. We will use the debate for your questions, and you can also raise your hand and ask your question directly. This is all concerning the housekeeping rules, and before I hand over to Professor Fiala, I would like to introduce him. Professor Fiala is one of the presenters. Professor Dr. Petr Fiala, PhD, focuses on medical acupuncture for over 4 decades. He is a member of the second generation of Czechoslovak doctors, acupuncturists, whose society has been established 55 years ago. He is our foremost expert in the area, and he represents this profession in international organizations. He focuses on patients after cardiovascular events, and he is a member of the Czech Medical Acupuncturist Society and some other societies at various continents. As of the 90s, he is also a pedagogue, and he's a member of the International Committee for Education in Medical Acupuncture, Board of Education, IC MART. He is heading the acupuncture department in the IVPZ, Institute of Postgraduate Education in Medicine in Prague, and he is a head of the working group for complementary and integrative medicine at the Ministry of Health in Prague, who co-organizes this conference in the parliament. And I would like to invite you to the rostrum now, and we will learn more about the foreign experience as well.
Takže já velmi děkuju.
Thank you very much for the introduction. You characterized me well, but out of that, I'm quite a normal person. I am the leader of a working group that was established almost 2 years ago, as per which many patients and deputies and senators to include into our healthcare fields and methods that are not considered traditional, like biotronics, acupuncture, and others. But these are fields that help people, that have helped thousands of patients, our citizens. And since I'm of age, let me inform you that at the times of the totalitarian regime, all these methods were labeled as bourgeois non-sciences, non-scientific fields. After the Velvet Revolution, these fields were called unscientific. But the world progresses, and as you may know, for example, acupuncture is a regular professional specialization taught in medical faculties and performed by expert doctors. The same applies to homeopathy. In almost all European countries, there are licensed healers with basic education and with awareness about the method that they apply and their basic knowledge of a functioning of human organism and illnesses is guaranteed for the patients. Throughout the 30 years of this trend, we have not really accommodated to it too much, and all the fields have been marginalized. Some of them are tolerated, some of them are not tolerated, some of them are condemned or sneered at. And it is a fact that with some rare diseases, we don't know how to heal them, and we are forced to send sick children to establishments all over the world to help them heal. So we really do need these fields. I'm very happy that Mr. Senator, this lady deputy, and the Ministry of Health have co-organized this conference. And in the last 1.5 years, we have mapped the field. We have worked out research papers. I can show them to you. We have scientific portals that deal with these fields. So even our legislators have now documents available to them, so they would know how to proceed in future, how to anchor these methods in our legislation so they could be performed legally. Since we have no one from the Ministry of Health here, I will cut this introduction short. Let me just introduce to you the speakers who will share their experience. We will have Dr. Váňová, Professor Tichavský. They will bring one patient, each of them. Then I will speak about medical acupuncture. And Mr. Olšák will speak about the really miracle he performed. We will have Mr. Tomáš Pfeiffer, a well-known biotronics and healer. And this will be it for the Czech part of the conference. And this will be followed by our foreign speakers. Dr. John Hughes, Mrs. Nora Laupstein, Mr. Federico Palla from Italy, and Amarjit Varma from the United Kingdom. So this is the order of the day. Every block is scheduled to last 1 hour. The presentations will not exceed 15 minutes or maximum 20 minutes. Whenever I teach, I always tell my students, let's not have breaks. Everyone can have their technical break according to their needs. So please, you have been told already that if you need to leave the room, you can do so individually, and we can meet for refreshments after the conference. The first to speak is Dr. Váňová. Let me introduce her. We've known each other for decades. Dr. Váňová is the founding chairwoman of Homeopathic Association. She's a practicing doctor, and for almost 25 years she's been teaching homeopathy on international level. Homeopathy is very popular in France. There is an education center for homeopathy in Paris. And she's also attended many congresses and international conferences. Dr. Váňová, you have the floor. Thank you. Homeopathy is a therapeutic method that I've been dealing with for more than 30 years. At that time, I attended the first such presentation in 1991. Together with many other doctors, we listened with great attention. I first disbelieved homeopathy. I thought it could not work. I thought perhaps that this is perhaps similar to wanting to cure angina with a streptococcus drug. But then I was convinced, because we saw cases of patients healed the first such patient to be healed was my 6-year-old son, and I really started to study all homeopathic fields. At that time, the Czech Republic was a crossroads of all homeopathic fields, and since there was no continuity like in other countries where they have practiced homeopathy for 200 years because the totalitarian regime prohibited such method, perhaps that is the reason why homeopathy has not been integrated well into the awareness of patients and medical doctors like elsewhere, and we should correct that situation. Homeopathy is, in fact, European cultural heritage, which is spread all over the world. It started already with Hippocrates, who already treated people according to the law of similarity. 200 years ago, Hahnemann has coined homeopathy and gave it a scientific basis. And thanks to new knowledge of quantum physics and IT, Hahnemann's hypothesis is having an evidence or is there is basic research. I will not speak about that. You will listen to a presentation of Professor Tichavský, who deals with agro-homeopathy. And he will have a very authentic presentation about that. So there are clinical studies which are more important for us medical doctors. There have been many such studies. Since 2014, there has been a breakthrough in these studies because we've started to respect individualized homeopathic treatment, which has almost 2 times a better efficiency when compared to placebo. You can read about that. There is high-quality information material created by a homeopathic association. They list these medical cases with all the references. Homeopathy is a specific treatment method. The name comes from Hahnemann. Homeo means similar, so it is in line with law of similarity. That is the basic attribute of homeopathy. Unlike allopathic medicine, a term also coined by Hahnemann, but we know that we need both approaches. The law of similarity means that the drug must be similar to the symptoms of the disease. There is dilution and dynamization, so we preserve the effect, but we get rid of the toxicity. Homeopathic medicines are produced from mother tincture, from plant and animal origin. The contents of the active ingredients is accurately determined, and we know how it will act based on biochemistry, pharmacology, and physiology. Homeopathy is a holistic method which looks at physical and mental symptoms, so we can individualize the drug. We do not maintain that homeopathic medicines should replace classical drugs, but they can be used as a complementary method. It is good for even for children or pregnant women. Homeopathic medicines may help in mild and moderate affective diseases without a risk of addiction. Homeopathic children treated with homeopathic are not so often ill, and they have better psychological immunity or defense. Homeopathy helps to save costs. We see in our practice that homeopathic drugs help maintain health of children and adults, and it helps save costs in healthcare. Including homeopathy into everyday practice is useful. It will help improve the quality of health of the individual patient and the whole population. This is why we need to speak truthfully about the possibilities and also limits of this method. To enhance education and to connect ourselves with other countries where homeopathy is practiced. We have established Homeopathic Medical Association with three main aims, so that every medical doctors and pharmacist knows homeopathy, so every patient would receive the most suitable drug, be it homeopathic drug or another one, and the responsible institutions should respect and support homeopathy. We educate healthcare workers based on the CEDH concept. We participate in international congresses. The last such congress took place in Brussels. The chairwoman, Dr. Ilona Ludvíková, took part, and also Dr. Kacířová. We have many experts. We don't lack the quality of experts in homeopathy in this country. We just have problems with the bureaucratic setup of homeopathy. In other countries, homeopathy is in line with other traditional medicines, and the doctors should be given the right to choose. There is an important platform, the World of Homeopathy, that you see on the slide. There are many instructions and advices from experienced patients, medical doctors. You can look it up on our website. 100 million citizens in Europe are treated with homeopathic. It should be the right of every citizen to choose homeopathy. This has the potential to support national, European and global initiative for controlling the current health problems. The time has come to integrate homeopathy and other TCIM methods into medicines. There is antimicrobial resistance, high consumption of psychopharmaceuticals, and more chronically ill patients. This would be the responsible approach. And since the criterion of every theory is how it is applied in practice, let me ask my long-term patient, Mrs. Jaroslava Přibylová, to tell us about her experience with homeopathy. This is the picture of her son, who was 7 months old. He's now 25 years old. He's healthy, with healthy skin. When he was 7 years old, he suffered with generalized eczema.
Thank you. Good afternoon. Or good morning, sorry. First time I've encountered homeopathy when I was 16, when I met my husband, my future husband. I had very many herpeses, which was undesired, and my friend sent me to a homeopathic doctor, and since then I had no herpes. And second big experience came after a few years. My newly born son suffered from eczema. We went to allergology, immunology. He was hospitalized at a clinic in Brno. He was treated in Research Institute of Children Health for a food allergy, and his condition became worse and worse. He was not able to sleep, and we found a pediatric doctor who recommended Miss Váňová from Litovel. He was the first one who solved the root cause of the disease, not the symptoms. He prescribed homeopathic treatment. The eczema healed in his fingers. He was able to play with the other children. We were so happy that his condition improved thanks to homeopathic treatment. He is 25 years old today. He is healthy, and if he has minor health problems, he uses homeopathic drugs. I also tested homeopathic drugs when I was giving birth to my second son. He had 5 kilos, and he was born in 1.5 hours. My third child was problematic. The birth was longer and problematic. But after 1 week of homeopathic treatment, I started breastfeeding. In 2012, a lymphoma was diagnosed in my husband in 2012, and homeopathics was used as supportive treatment. After chemotherapies, my husband didn't feel sick. He was able to work, and after transplant of stem cells, he worked in a month. He started working in a month, which is very early. He was treated in the faculty hospital in Olomouc, but homeopathic drugs helped him to recover much faster. A tumor of tongue was diagnosed in my father. He had a complicated surgery, including tracheostomy, and he was also supported by homeopathic treatment. After the surgery, the surgeon was surprised by reduced bleeding thanks to homeopathics. We were bringing my father to the hospital on a daily basis, and we could compare his condition with the other patients. His skin was in much better condition. He managed after last year's lungs inflammation. He was treated by ATB. His condition was very bad, and after homeopathic treatment his condition improved. The Miss Váňová treated myself, my sister, my parents. Homeopathic treatment is helping us for 20 years. Without it, we couldn't cope. I know that homeopathy cannot beat cancer, but we could use it as a supportive treatment. Recently, I met one young doctor, surgeon from Vyškov Hospital. I told him that we're missing a pediatric doctor fond of homeopathy, and he told me that it is completely ineffective and not scientific. I told him that our family is treated by homeopathy, and he was taken by surprise. The students received negative negative information about homeopathy. Thanks to our positive experience, I decided to address you, and I hope that as many people as possible will be able to get homeopathic treatment. Thank you. Thank you very much. And now I'd like to give the floor to Professor Tichavský. When I checked his CV, I thought another musician in medicine, and I remembered one of the biggest humanists of the 20th century, originally a music composer and expert on Johann Sebastian Bach, organ player, theologist, and when he passed all that, he decided to study medicine and work with the poorest of the poor in West Africa. It was Albert Schweitzer who's built the Lambarene Hospital later on, and the whole world monitored his activities and appreciates his work till today. I'm glad that we have similar humanists among us. The world is not led by dictators, terrorists and others, but on Albert Schweitzer, Mahatma Gandhi, Mother Teresa and others. They are the fundament of our civilization. So, Professor Tichavský, the floor is yours. Thank you very much, Miss Balaštíková. Thank you very much, Dr. Váňová. We came from Mexico 4 days ago, so I still have jet lag. I'll talk about health that starts in a field. It might sound peculiar, but I hope that after my presentation you'll change your mindset. Health starts in the field. How to improve the capital of complex soil? Why do I need it, you might ask. If you have a complex soil with a complex colony of bacteria and fungi, you can get more complex plants. And if you eat it, your microbiota gets complex input, and it improves your health. As in any method, you have to measure. We measure the vitality of plants and system using different methods. We carry out fractal studies, we use satellite photography, and in the satellite we study the so-called attractors or decubits. Attractor is a highly fractal location, and decubitus is a place with low fractality. So we generate a fractal map, and we use the attractors to make the substances that we apply on the whole holon, on the whole land. So we take the vitality and spread it over the non-vital locations. Then we apply the method of crystallization of droplets evaporation. We take a micro droplet, we let it evaporate on in a microscope glass under controlled conditions. Then we monitor it under the microscope. We take a photograph and measure fractality. And in the droplet, we can measure the fractality in a droplet from 0 to 2. If you have a plant and make an extraction from a sap, and if you put it into a distilled water, if you put a seed of a plant into a distilled water, make a micro droplet, dry it and crystallize it and measure the fractality, then you're able to measure it reliably, and you can say it has got 1.85 fractality, and that's fractal distance. And a hydrolate of pepper seed bred in conventional agriculture, relatively high fractality, 1.7112. And on the next slide, you can see the hydrolate of seeds of a plant bred in holohomeopathic agriculture that only uses water and homeopathy. And you can see the fractality, fractal distance, 1.9103, which approaches the ideal of fractal distance. It is a mathematical ideal which does not exist in nature. In nature, you can only have plants or animals with 2.0 fractal distance. That's the ideal. And inside the droplet, you can see a kind of can I zoom in? I wanted to show the fractals in the middle of the droplet, kind of trees. And now let's compare it. This is the comparison. On your left-hand side is the normal agriculture droplet, and on your right-hand side there is a homeopathic result. And this is the sap of the pepper, conventional agriculture, 1.74 fractal distance, and this is a sap of pepper with fractal distance 1.9173. Fractal distance in seeds and in the sap and in variability or complexness of the macrobiota with which the plant cooperates, it's all reflected there. And when you make a calculation of a fractal dimension, you arrive at this conclusion. And this is a difference between the conventional and the holohomeopathic agriculture. This is a result of a research we carried out in cooperation with Bologna University. And on your left-hand side, you can see the hydrolate of wheat seed bred in conventional agriculture. Crystallization is not organized. It remains chaotic. It is a chaotic cloud without any organization. And on your right-hand side, there is a hydrolate of wheat seed bred in biodynamic agriculture that uses, for instance, homeopathy. These are lovely crystals, as you can see, which have a positive impact on health. And we carried out experiments in people who ate this wheat with high fractality. We measured fractality of their saliva and urine, and in the same proportion, it was there, the fractality in every part of a human organism, and it also impacts fractal thinking.
Thank you. I have to make you aware of the time. You have the last minute. Thank you. Benefits of polyploid crops, let us skip that. This is a polyploid wheat with 6 copies of DNA. Ancient varieties of wheat with beautiful fractals. Skip that. Once again, fractal distance of soil, 1.98, holohomeopathic soil, 1.65 of conventionally treated soil. This is another comparison. Go on, skip that. Go on skipping. Some more. And this is an example from industrial practice. There's an assumption about low productivity of hollow homeopathic method. So let's look at the reality. We had a project regarding bell peppers in Spain. This is a greenhouse. These plants go without a drop of chemistry or any cow manure or any other manure, just homeopathy and water. Skip that. See, the plants are healthy, clean, no pests, no diseases. 3 hectares in a greenhouse in Spain. Go on. This is the crops harvest. And when you ask the farmers what they think about agrohomeopathy, they will tell you they love it. And do you know why they love it? That's why they love it. Perhaps they don't understand how we do it. Go on. Summing up, hollow homeopathy is an innovative method in agriculture, making use of crystallization and evaporation of droplets to measure fractal distance. This helps measure vitality of plants, quality of fruits, and the influence of soil on the plant. And the research proves that homeopathic agriculture leads to higher fractal complexity, which is reflected in human health, higher microbial activity, better quality of the fruits, supports sustainability of agriculture, and maintains the health of the population. And it is interesting that plants do not know about placebo. They will either grow or they won't grow. And we've been practicing this all over the world, outside the Czech Republic, in Spain, Italy, France, using federal or national funds, Brazil, India. We had 2 large projects in China. Just in the Czech Republic, there's nothing. Hopefully, things will improve from now on. Thank you.
Děkujeme pěkně.
Thank you very much. Thank you once more. This was really interesting and very surprising for most of us. Let's speak about a different field. From homeopathy, we will now speak about acupuncture.
Tak. Lékařská akupunktura
medical acupuncture, I will tell you how it originated and where we are today. You won't be able to see it on these screens too well. Perhaps I will be able to show you the important part on the screen. You can't really see it very well. We've always thought about acupuncture as a thing about Far East or China, but the oldest stimulation of points that we call acupuncturic points took place in Europe. We know the Iceman who was tattooed. This was about 5,500 years ago in Europe. And until today, the civilization group survives in Central Europe and North Italy. But the descendants of Etsi abandoned this field, most probably because the tribe because the tribe died out or it was killed off. And then until the turn of 19th and 20th century, no one took up the field. But in the meantime, the method, because our software and hardware is functioning in the same way all over the world. So it was taken up in China, and the Chinese preserved it. So about 2,000 years BC up until the 15th century, it developed very quickly, and the Chinese science and culture and medicine really were much more advanced than the European one. But this this ended with the Ming dynasty from 1518 to 1593. This was then they were defeated, this dynasty, and there was a decline that still takes place now. Then European colonists invaded Asia, and the ancient civilizations could not compete. At that time, in the West, a different culture was popular, because we had the era of critical thinking, of enlightenment, of humanism and Renaissance, and that brought with itself a disbelief, a lack of confidence into any other type of thinking, and this led to the outcome that less defined scientific fields were looked upon without confidence. But then gradually they returned to the European continent, and the Austrians and the Germans especially returned acupuncture back to the whole family of medical fields. We know about the roots of the irritation of the points, how they lead to the brain, how we can treat burns and other diseases with acupuncture. Let me briefly show you he had a group of 61 different tattoos on his body, which are used up until today, this location of points. Professor Samadoli from Milan made a research of these points, and he derived that they used ash from wood, which helped treat various pains, injuries, and diseases at that time. So this is how people were treated all over the world, with acupuncture. So what took place in the meantime? When we look back and use the modern knowledge, we can see that they were stimulated nerve endings in various points. These are the acupuncture roots and nervous neuron roots that connect the point with the brain, flushing out endorphins and enkephalines. And these signals help heal human body. We stimulate certain cells, creating direct connections of these cells to the brain, helping to heal the person. As a result, all of us who are active in these fields have agreed that we will prepare some documents for our legislators. So we made a research in this complementary and integrative medicine all over the world. Since we are members of the EU, we had the research carried out in France, Germany, Austria, United Kingdom, Italy, Slovakia, and Switzerland. In all these countries, these fields are studied and tested. There are three basic criteria which the governments look at. That is the safety, because medical doctors know that they must not harm the patient, primum non nocere. Then efficacy, whether it does help the patient, and efficiency. That was a very important factor in the decision to pay or not to pay for such treatment. Acupuncture in scientific databases. It is important to see whether someone publishes in well-respected media, PubMed, Cochrane, Web of Science. All these are renowned databases which are essential for medical scientific methods. On PubMed, we have published more than 42,000 articles on acupuncture. This is research based on random choice and clinical effects. So that's a good reason to recognize acupuncture as a regular medical method. In the United States in the 1990s, they have been studying this point on the wrist, which is efficient against vomiting and nausea, post-operative vomitus, and it helps really post-operatively. It does not help pregnant women, but they started to manufacture these bracelets, and they've been active for 24 hours a day. They helped people. WHO in 2008, at a time when there have been many studies published, randomized studies. Already there's a list of publications where the diagnosis and indications were really proved by evidence-based clinical studies and research. This is an example from Germany. The Medical Acupuncturist Association was founded in 1951. It has been accepted as a medical field, and from 2003 it is recognized as a regular medical specialization with attestation. Germany is not the only one, so it is a method that is well proved. In Germany, they have guidelines for treatment of patients. They have 819 guidelines, and in 97 they mention acupuncture, and in some other ones acupuncture is recommended as the suitable method. In a few indications it is also covered by health insurance. There are 43 medical faculties in Germany, and they also teach acupuncture as a pre-graduate field in 22 of them. We only have one. Professor Ernich in Germany, who is the leader of the Clinic of Anesthesiology in Munich, is also an acupuncturist. This is the cooperation in complementary medicine in the EU. You can see an important role played by the European Commission and the European Parliament. A German colleague made this slide for us to see how the cooperation works. We should really join join this system. Our new deputies to the European Parliament should try to incorporate the Czech Republic into this system. Let's hope that also medical doctors will be on board with this. So this is a system that perhaps is not important for the patients, but is very important for the doctors. In the Czech Republic, we have one primacy that has not been followed in China or even in Japan. If they want to find out whether acupuncture is will help in burns, they use rats. And I asked them at a conference whether they know of this point, LU7, French doctor Le Barbier, who was one of the pioneers in skin treatment, mentioned that this is good for skin diseases and burns. In the year 1981, one doctor from Dobříž asked whether it would be good to try out this point, was telling us that he tried to use this point on children who suffered, little children who suffered burns, and that it helped. So we followed his advice. Every Czech person should really know this point, and we should all know this. We should all carry out a little needle with us, because this works as a miracle. When you get burned, you will not develop a skin injury. Dr. Loskotová from Vysoké Mýto knows a lot about it and has been using this method. So this is one discovery that we can be proud of in the Czech Republic. And the last slide. This is the concept of synaptic bypasses. We know coronary bypass, which is used in heart disease. Good surgeon can help you with a bypass, but a similar thing is conducted by our brain in central nervous system in our brain. Recently, these pictures have been published. The nervous root in brain, when it gets broken, when we use correct acupuncture points accompanied with electricity, and we provide the neurons with signals, a bypass is formed for the neural points to be reconnected. And in every one of us, there are about 130 billion neuronic cells, and they are interconnected. And when a nerve is broken, there are various connections, links, reconnections. You will hear more about this by Dr. Olšák. How this takes place in the human body. So that's a model that has not been established in the world, so we hope to have another primacy. So let me now introduce to you Dr. Olšák, who will have the next lecture. He studied medicine in Olomouc. He started to carry out acupuncture, electric acupuncture. He is a primacy with a special type of needles. He worked in the field of recovery, and he looked at the broken nervous roots. He would measure electrical potential. We call it EMG, electromyography, and it worked well. Prior to acupuncture, there was no signal. After stimulation, the signal was reconnected. So where did it come from? Perhaps from the bypass. So let me give him the floor right away.
Hello, good morning. Thank you very much, Petr Fiala, for this lovely introduction of our discipline. There is a high potential in it for very many diagnoses that couldn't be solved and attended as they can be today, thanks to acupuncture and electroacupuncture. So, the clinical cases of the patients. At the beginning, when I started with acupuncture, some of my colleagues were led to believe that I lost my mind, that I'm crazy. But this has already changed. We treat patients from all Czech Republic and from abroad across the spectrum of handicaps. When I started with this methodology, at the beginning I monitored clinical development and video documents, and we were then urged to provide exact measurement. We started to use kinesiological laboratory. This is a case of a patient measured in our laboratory more than 6 years ago. She had a problem with the left upper extremity. It was a paralysis, and she tried to move her arm. She had a peripheral lesion, and it was not assumed to improve. But I'll show you the second video on your right-hand side. And after 20 minutes, the patient is able to move with her upper extremity much better. This is not common in lesions like this. We are glad that we have EMG sensors and gyroscopes that we used to measure the patient. And here we can see that the patient passed a so-called functional glass test. She tries to reach the glass before the application. It's impossible because of the severe damage. And on the next video, you can see that the extremity is stronger, and she's able to grab the glass and put it back on the table. And the time difference between these two videos is only 20 minutes. And here we have a EMG record of this patient. Initial slide, low activity, minimum activity, and after 20 minutes the same muscle shows a big difference in EMG record. EMG sensors, we used more sensors. The first two columns that are there, the first two horizontal records show that the muscle key for the movement does not work, and the biceps tries to do all activity. And after the application, she started to use the muscle which was most problematic. And now Petr Fiala will remember the patient. He looked at it. I arrived to Prague, and in 9 days the patient was able to move this way. We can see the improved motricity of lower of the extremity. She doesn't have the muscle on her right arm, and she is able to reach this improved motricity. This is the same patient. It was a grant, and we measured the patients in a longer horizon. After 1 year, you can see that the muscles there and the motricity is back. We wouldn't say that there was a paralysis. We carried out an MG, and the chief doctor told us he sees no change there. So she healed completely. This is a patient who's 70 years old, severe paraparesis, and she was not able to stand independently. She had a severe spinal lesion. This is a video from 2017, and people were led to believe that this is only fit for sensitive patients, and this is a video document. Before we started to apply the therapy, we asked the patient to move her lower extremity, and we only received spastic reaction. This is one of the applications of electroacupuncture, and we can see improved motricity. And here we can see that after we removed the needles, the patient is able to move herself using her will. This is a huge and very fast improvement. People might object that on the next day it'll be again in the original bad condition, but that's not the case. The second day after the application, the patient was able to move her lower extremity. 1 year after the treatment, she was able to walk, and she was able to walk 2 kilometers. She walked her dog. From time to time, she had to sit, but that's very normal. Patients are able to regenerate, and we didn't see that in standard methods. This is a male patient with a severe left hemiparesis, and we can see the sensors applied on a patient. He was not able to walk independently. He needed a support by a physiotherapist. On the next slide, you can see that we measured one of the important movements with a person after central stroke. You can see the motricity, 20 minutes difference. The scope of the movement and the strength of the movement is very different. On the next slide, you can see the change in the EMG signal in the key muscle that is necessary for this movement. It is the activity before and after the application, after 20 minutes only. And we monitored the patients every 20 minutes so that we could confirm that there was no other method used. We were able to say to what extent the acupuncture and electroacupuncture improved the condition of a patient. And after 1 month time, the patient started to walk independently and his walk looks differently. There are some minor changes that remained there, but it's similar to a walk of a healthy person. This is another important case, patient of with lesions of cranial nerves. We could see how they move with their lids. This is very difficult for rehabilitation. And the patient was able to move his eye and his eyelid. This is a huge difference compared to the previous situation when we had nothing, no therapy to offer to these patients. We are able to improve their condition today. This condition is really limiting for the patients. This is the application of electroacupuncture in suckling in an infant younger than 1 year of age. We can help them exactly. You saw the motoric response, which is huge. And the little girl is able to cope with the application. It's not unpleasant for her. Majority of us wouldn't be okay with it, but the infants manage. We can help them because, well, if they suffer from severe hypotony, the girl started to move and move with all 4 extremities. It helps us to provide a high-quality rehabilitation and improve the forecast of infant development, and it requires no cooperation of the patient. This is a video of a patient from Janské Lázně spa, severe paraparesis. This is a story. We can see the application. We can see the movement that was impossible before. And this is the improved motricity. He was able to control his lower extremities, to stand up, and we can see his first steps. That was unthinkable before the intervention. This was a very strong and resilient boy who really wanted to walk, and you can see him walking. This is the first independent walk. He was able to walk this way. Not all of us can do what he can do. It was a difficult lesion, and he is able of it. So this is before his departure. He showed us that he's able of independent walk, and he'll show a few jumps. Let's wait for a few jumps. This is what he can do. We were very satisfied with this severe paraparesis development. He was able to start a normal life. The very last slide of mine. We don't need the sound. It was a patient that was examined in a faculty hospital in Motol. She had a difficult lesion, spinal cord lesion, and in 4 weeks After 4 applications, the patient achieved this considerable motoric change. So this means improved quality of life. Electroacupuncture is not a complementary method today. In many diagnoses, it should become a method number 1. It should be available to our patients. The methodology is fast, safe, and effective. This is critical. And the very last slide is thank you for your attention.
Já taky děkuji.
Thank you. This seems a bit like a miracle, because whoever has seen similar problems, we know how difficult it is after paralysis, after cerebral events. It is very difficult to help the patients, but here we could see that this is possible, and those of us who work in these fields believe that we are something like national pioneers trying to help the patients. And many people in this country know of someone close or distant who has suffered such a problem and who has been helped. It is really very demanding for us not only to practice medicine but also to go on teaching and disseminating this knowledge and also carry out research. We need to finance this research and further teaching, education and outreach. You can see what has already been achieved and what would be really beneficial to our citizens and patients. And now let us reach into a different field. The next speaker is Mr. Tomáš Pfeiffer. I don't think he needs any introduction. He is one of our best-known healers. You can read here about his achievements. I remember him from the totalitarian times. We had no gray hairs at that time, and we both dealt with these so-called dubious methods that we believed could help people, and we stuck to that belief. He has been active with traditional, complementary and integrative medicine. He has many plans for future. He will speak about it himself. Good morning. Good morning. Thank you for the introduction. I'm active in the field of biotronics. This is a field which is not very well known, and but every field that you've heard about had a beginning 5,000 years ago, 1,000 years ago, or 10 years ago, but there's always a beginning. When I was preparing this presentation, I was thinking about how to best introduce biotronics. There are pieces of information known about this field. It has significant potential to disseminate complementary and integrative medicine, and it can help patients which cannot be healed with classical procedures. Similar to the previous presentation, which I listened to with great joy. Biotronics was founded by this man who, after the year 1945, started his work. He had tried to communicate with EBM medicine, and I walk in his steps. He's been thinking about the human organism, its 3 basic components, the physiological, psychological and vital biological forces. And this is also where the biotronic intervention takes place, and the vital biological forces. These forces can be divided into four basic groups. The biotronics applies them as a focus based on the diagnosis. And unlike other traditional methods or conventional methods, the biotronics may achieve good results. Let us listen to the Chief Dr. Oliva about his experience with this field. In the beginning of our interest in healing, there was our personal experience with Mr. Josef Zezulka, an excellent healer from Prague. We had very positive experience. A patient with a carcinoma became healthy again, recovered. This is 18 years ago. Based on this experience, we contacted him 2 more times. We had cancer patients in both cases. In both cases, they recovered. And this experience is 10 years old in both cases of these patients. Thank you. In spite of the critical view of the previous regime, there was a research project in 1982, although it was not allowed to come to the end. There, it looked at the cases of 20 patients. Out of 20 patients, the evidence could not be proved in only 2 patients, and in 4 patients, the research had to be terminated because of the police decision. There has been a mild to significant improvement of the health condition in the patients. The most significant result really can be labeled as a miracle. The patient was dying. It had a terminal tumor, gastric tumor, and it was totally revitalized after 7 days of biotronic intervention. The colostomy was spontaneously healed, and the stool passed in a natural way. This is such a significant case that if it wasn't for medical documents, it would be very hard to believe. Let me introduce to you my work as well. From 1996, it was 3,622 medical or health interventions. You can see the percentage. Cancer 43%, neurological 19%, cardiovascular 16%, up to other diseases. At this point, I would like this presentation to be conducted by the medical doctor, who is also a speaker, and he will speak about his own case. This was a tumor. And he can take the floor now. Good morning, ladies and gentlemen. My name is Petr Valný. I'm an internal doctor. I will briefly speak about my highly positive experience with biotronic treatment. I was diagnosed with a cancer of lentigo melanoma on my nose, which was growing. In December 2012, it was 7 times 4 millimeters large. The decision was made to take a vital sample, a malignant melanoma, which was growing on the surface. A surgery was indicated. At that time, the tumor was 10 times 8 millimeter. It was growing rapidly. You can see on the monitor the central brown portion was the original carcinoma, and it started growing where the sample was taken. It was decided to go for a radical surgery to cover and then cover the skin with a piece of skin from another part of the body. It would have been a 3 centimeter defect, quite an extensive surgery that would have covered the better part of my nose. This was followed by biotronic treatment for 3 weeks. In the course of the biotronic treatment, the tumor went back to its limit, and it was very interesting to see the behavior of the tumor after biotronic treatment from distance or from close up. Every time the tumor reduced, it changed its surface to an orange-like structure, and gradually, after a few interventions, it really reduced. After a consultation with the surgeon, we decided for a less radical step. We decided to take the skin graft from a different part of the face. The surgeon did a very good job, and this is what he did. You can see the upper picture 3 days after the surgery. After I was released from the hospital, another biotronic treatment, which was then repeated, and I was able to go back to work very quickly. The histology confirmed the diagnosis of the type of melanoma, and the biotronic interventions proceeded even post-surgery. So application of biotronics allowed for a less radical intervention, smaller traumatization of the patient, better aesthetic effect, and shorter time of sick days. Thank you. Let me now give the floor to Dr. Korisová. She will proceed. It is my task to tell you about the most interesting cases where biotronics was a significant help. The first is a 35-year-old woman with a diagnosis of papillary carcinoma of both ovaries. At the time of primary diagnosis, it extended to the whole abdomen. She was operated on, and there was chemotherapy and other therapy. And at the time when the tumor was 16 centimeters, it reached up to the navel. The patient was very thin. Biotronics was applied, and the next story is this: 2.5 years after 2.5 years of biotronic treatment, the tumor disappeared. The next case is of a 70-year-old woman who had trouble breathing, and she was diagnosed with a small cell bronchogenic carcinoma. with metastasis in mediastinal and cervical nodes. There was palliative chemotherapy, intensive chemotherapy, and 8 cycles of chemotherapy. Later, it had to be stopped because there was a significant reduction in bone marrow, and the patient was released home, expecting her life to end. After 3 biotronic interventions, the blood count was improved to normal, adjusted normal, and she proceeded with biotronics. 12 years later, she could be released from the lung observation, and she lived 15 more years after the diagnosis. So she died when she was 84 years old. She was she has fully recovered. The next case regards a 53-year-old man with a malign melanoma in left leg. The primary surgery took place locally and of the nodes. 1 year later, we could see that it was not sufficient because the tumor progressed to more nodes. I'm honored to welcome this patient here. His case was a long one. He had multiple chemotherapeutic sessions, many surgeries, and in spite of all that, 3 years later, it was decided that the oncological treatment is without any hope because the tumor progressed too quickly. The primary biotronic intervention was conducted on distance, and in spite of that, the treatment was successful, and even after the first such session, the tumor stopped progressing, and in the next stages there were focused biotronic interventions. Josef has been living for 22 years more, as you can see after this event. This is carcinoma in a child, craniofossa astrocytoma and hydrocephalus, which caused the child to maintain a wrong head posture. There was a biotronic intervention prior to surgery, which was very good because the biotronics can help reduce or define the tumor in a better way. This was successful 3 months after the surgery. The magnetic resonance was negative, and neurological finding was also negative without cerebellar and vestibular symptoms. That you can see the picture of the child happy on his ice skates without any problems with his mobility. 10-month infant with hemolytic uremic syndrome and severe renal failure. This is a very painful experience. But once again, we have this young girl here who is here with us to provide evidence that such severe renal failure when she was very, very young, she was she was saved by biotronics even after the first biotronic interventions. The nephrological findings stated that her kidneys recovered and functioned normally, and this is the fact even today. Thank you very much for the presentation.
And in conclusion, I would like to present my best story in my career. It was not Ante Portas patient. This patient had no further oncological treatment, no other treatment, but let me give the floor to the chief doctor and the patient herself. So this is the securing bolt story. Yes, this Miss Wernerova, I can remember her very well. It's going to be 20 years ago in May when she came to Nymburk Hospital, and she lost a lot of weight. She had anemia. We found a stomach tumor, and she had a surgery. Adenocarcinoma was proven. Gastric adenocarcinoma. I received a phone call. I saw the tumor that impacted duodenum. It was an inoperable tumor. Yes, well, it was a palliative intervention because the food was not able to leave the gastric part, and they made a bypass for her to be able to eat and drink. We added blood and we sent her home. At home she received transfusion and some drugs with more iron. No cytostatics, no other treatment. The tumor was too big, so we decided to let it be, as cytostatic treatment would be harmful for her. So we thought, yes, let us wait. If she survives the stage, if she comes to terms with it, then maybe in the future. She contacted Mr. Pfeiffer and we decided to give it a try without chemotherapy, and it worked well. She gained some weight and she felt well. I saw her a year ago. Mr. Pfeiffer did refer her to me. She had high blood pressure, and we checked out her abdomen. You can't imagine the examination. There is an 8 centimeters encapsulated tumor in her abdomen. There are no liquids, no metastases in the liver, and it's all clean. We have also cured the thyroid gland, reduced function, and there are no problems. Tumor markers are completely negative. Well, I think that we have to use all possibilities, and if a patient is under control, then it's perfectly fine. And I really believe that Mr. Pfeiffer simply made it. He succeeded. Thank you very much for your attention.
Všichni jsme lidé, všichni.
We're all humans, and I hope that these interventions will not be needed. I wish you all good luck. Thank you. Let me close the block of the Czech presentations. No microphone, sorry. No microphone. My apology to the foreign speakers, and let me now open the block of foreign speakers. We have 15 minutes delay, but I hope that you are experienced enough. It's normal. 15 minutes is not that much. So the first speaker is Mr. John Hughes.
Presentation. Senior researcher from Royal College in London. Vedoucí expert z Královské nemocnice v Londýně.
Leading expert from Royal London Hospital.
Dobré ráno. Good morning, and yeah, thank you for that kind introduction. John Hughes. So that's the hospital I'm based at. It's the Royal London Hospital for Integrated Medicine. I have a couple of roles there at the hospital. I'm the head of research at the hospital. I'm the head of our WHO collaborating centre within traditional, complementary and integrated medicine. And I'm also an associate professor in integrated medicine at the University of West London. Now, the slide you can see there, hopefully, will just give a long list of complementary approaches. The list isn't exhausted. I know there's lots of other interventions I could have put on that list. Now, one of the earlier presenters mentioned about when we're considering which of these complementary approaches should be incorporated into a country's national health service. The three important points to consider are, is it safe, is it effective, and is it cost effective? Now, all complementary approaches, not all of them are effective. That's a simple fact. There's a number of interventions on the list for which that intervention, despite undergoing research, that intervention does not appear to have a specific effect on any named condition. Now, in the UK, what we have is the National Institute for Health and Care Excellence, the NICE guidelines. The NICE guidelines, the NICE Institute, they will examine the research evidence base for conventional approaches as well as traditional and complementary approaches. And they'll give that to an experienced researcher, generally from outside of that field, to evaluate the evidence so that they're given an unbiased opinion on that research evidence. That the bar to be accepted within NICE as being effective is a high bar. And you'll see that there's only a limited number of those complementary approaches from the first slide for which NICE will accept that these are safe and effective interventions and should be provided within the UK's National Health Service to patients. So admittedly on the list, I've given what could be a broad definition of integrated medicine. So you'll see, for instance, exercise and nutritional approaches. You'll also see on that list what could be considered to be psychological interventions. So things like cognitive behavioural therapy or hypnosis, or mindfulness, although obviously mindfulness is an intervention that's taken from Buddhist meditation techniques and just stripped down of some of its more esoteric components. And that list is what we can currently provide within the UK's National Health Service in terms of those TCIM approaches, traditional, complementary approaches, and they're only provided for limited conditions. So acupuncture is provided for headaches, migraines, and chronic primary pain conditions, so things like fibromyalgia. Hypnosis is only provided within the UK's National Health Service for irritable bowel syndrome, nothing for no other condition. Tai Chi, yoga is mostly for musculoskeletal conditions. So it's a very small number of those complementary approaches for which the evidence base is at sufficient standard that organisations like the National Institute for Health and Care Excellence would consider that it is of proven effectiveness. Just a slight note at the bottom that the WHO, their approach or their bar for evidence to demonstrate that it is effective is actually lower than the NICE guidelines. So the WHO would accept more treatments being effective than is within the UK's current NICE guidelines. Now, just because there is currently a lack of evidence to show that one of these traditional or complementary approaches is not effective, that doesn't necessarily mean that those interventions are ineffective. For a number of those traditional and complementary approaches, there is still insufficient research evidence really to be able to conclude whether or not those interventions are beneficial. We're still at a level of equipoise, basically. We don't know whether the intervention is effective or isn't effective. Now, apologies for the slightly busy slide. So in terms of the type and scope of traditional complementary integrative medicine within the UK. So in terms of the titles, be that an acupuncturist, osteopath, chiropractic practitioner, whatever the modality is, reflexology, Reiki practitioner, those titles within the UK are not protected titles. So unlike, say, statutory regulated health professionals, if somebody's a medical doctor or a nurse, a member of the public cannot claim to have that title. In the UK, anybody can claim to be a complementary practitioner, with the exception of the osteopaths and the chiropractic practitioners. Those titles are regulated. The other ones are not. Basically, anybody, irrespective of the level of training, can set up in the UK as an acupuncturist, a reflexologist, whatever the intervention. Although they would be subject still to UK law. So around things like negligence, where the practitioner is seeing a patient, if there was some sort of negligence there, then that would come under UK's laws governing negligence. And they're also restricted in terms of things like what they can advertise, they could treat. So for instance, no traditional or complementary practitioner in the UK would be able to claim that they could cure cancer, for instance. That would be against the UK's laws for that. And like I say, in the UK, those traditional complementary approaches for which the evidence base is the strongest has been reviewed by the National Institute for Health and Care Excellence. Those then would, once the NICE guidelines recommend them for treatment, they then become available within the National Health Service, which is free for patients to access. So this is a publicly funded National Health Service. So those interventions, most effective, will be provided within the National Health Service. And like I say, really, in terms of those interventions, at the moment, it's mostly acupuncture, Tai Chi, yoga, mindfulness, and manual medicine. Manual medicine incorporates aspects of osteopathy and chiropractic practitioners, as well as physiotherapy. And within the UK, in terms of the prevalence, the number of patients using complementary traditional approaches, it really varies depending on what condition the patient has. And it varies in terms of what interventions you're going to include within that traditional and complementary approach. So for instance, you'll see surveys which can range from as low as 10% to sometimes as high as pretty much 100% in terms of use. But those with the higher levels of usage, they're likely to have included within the list of interventions things like over-the-counter products such as vitamins, minerals. They may well have also included things like prayer. If you include things like that, your usage, in terms of when you survey patients about use, your usage will go up. The paper in the slide, that was a survey we did a few years ago looking at oncology patients, and I think that one came in at about 70% of patients who were using traditional and complementary approaches. So in terms of the Royal London Hospital for Integrated Medicine, so this is where I'm based, it's part of University College London Hospital's NHS Foundation Trust. It's the largest public sector provider of traditional complementary approaches in the UK, and certainly one of the largest within Europe as well. We offer a patient-centred service, integrated the best of conventional and complementary approaches. All the practitioners working clinically out of the hospital are statutory regulated health professionals, so medical doctors, nurses, allied health professions, who have done additional training within a complementary approach and deliver that to our NHS patients. The hospital operates on an outpatient basis, and we receive referrals for a whole range of conditions. We do have an integrated pharmacy where patients can purchase over-the-counter products, and that does include herbal and homeopathic treatments. Pretty much all of the hospital's treatments are within the current NICE guidelines. Sometimes the hospital has a little bit of leeway where an intervention, the evidence base is slightly too low for NICE to recommend, but we can see that there's strong evidence that this is an effective intervention. We can then make a suggestion to provide that within the hospital, and we'll evaluate how successful that intervention is with our patients. So on the next slide, you'll see a number of the hospital's services. So you'll see things like acupuncture, adult allergy. We've got a children's service, integrative cancer care service, a large insomnia service, irritable bowel syndrome. The self-care service, that's got an asterisk next to it. That's because the self-care service is delivered by volunteers. So we did a qualitative study a few years ago looking at patients' perceptions of what self-care was. Basically, we were interested in improving the hospital's self-care advice. We wanted to understand factors that would facilitate or act as barriers to patients engaging with self-care. But as part of that study, patients identified a number of services they would like to be able to receive within the NHS. And that included a number of the softer complementary approaches for which the evidence base isn't strong enough for NICE to recommend their treatments within the NHS. So we do provide a self-care service which is delivered by volunteers. So it's not technically an NHS service, but that allows us to deliver some interventions such as reflexology, Reiki, craniosacral therapy to patients as well. Just like any conventional hospital within the UK, we do have a research department that I head up. We've received at the research departments in excess of £1 million UK. We've received awards from prestigious funders such as the National Institute for Health and Care, such as the National Institute for Health Research and the World Health Organization. We've disseminated research in over 200 peer-reviewed academic publications, and we supervise a number of postgraduate research students, including a number of PhD students, and including a PhD student who is based with us at the hospital from Charles University in Prague, and that's how I've come to be presenting here to you this morning. Now, like I say, we're a WHO collaborating centre in traditional, complementary and integrated medicine. So there's less than 30 of these centres globally. We assist the WHO in a number of areas relating to traditional and complementary medicine. In particular, we're supporting them in the development of competency standards in traditional and complementary and integrative medicine. So that's the sort of training standards that the WHO would expect a practitioner to have undergone before practicing, irrespective of which member state those practitioners are based in. We assist them in identifying good practice within traditional and complementary and integrative medicine. We're assisting them in terms of the evaluation of the benchmarks for specific traditional, complementary, integrative approaches. And in particular, we're starting with acupuncture. So we're looking at what acupuncture practitioners perceive of the WHO's benchmark for that modality. The WHO has developed ICD codes, so that's International Classification for Diseases. It's how conditions are monitored within member states. The WHO has developed ICD codes for traditional Chinese-based medicine. Well, I say Chinese-based medicines, but really it's an amalgamation of Chinese, Korean and Japanese approaches to acupuncture. And they've just developed Indian-based traditional medicine ICD codes for Indian medicine. So that's based on Ayurvedic, Siddha and Unami. And we're assisting the WHO with the work with those ICD codes. Now, perhaps of importance to yourselves, we have and do provide guidance to member states on how to incorporate safe and effective traditional and complementary approaches into the publicly funded National Health Service as well. So what we do within the WHO is, on occasion, we will provide workshops, generally over a few days, to provide that input to interested member states. Now, through the work with the WHO, we do know that around 100 countries globally do have a national policy, a national strategy on traditional, complementary and integrative medicine. In many of the WHO member states, traditional complementary treatments are part of essential medicine lists. They're a part of essential health services packages and are covered by national health insurance schemes. Like I say, the evidence base in terms of the safety and effectiveness of traditional and complementary approaches is growing. As more research is conducted, we're discovering more and more of these interventions are effective and the specific conditions under which they are effective. And the use and the provision of those safe and effective traditional and complementary approaches is growing globally. Now, I've highlighted at the bottom, so the WHO is in the process of releasing the global strategy for traditional, complementary and integrative medicine for 2025 to 34. The current, I was sent a couple of days ago, the new updated draft version of this. So we have inputted into that document already, and I do know what's within that document, though I'm not at privy to be able to tell you what's contained within it. However, it is certainly positive towards complementary and traditional approaches, and it will call on member states, including the Czech Republic, to increase the provision of safe and effective traditional and complementary approaches. And I would recommend it will get delivered to the Czech Health Service in the next few months. It will get delivered to them. And I would encourage yourselves and the Czech healthcare system to consult that document when deciding how to move forward in terms of incorporating traditional complementary approaches into your national health service. Thank you.
Thank you very much for your presentation. It was nice to hear all what could be done in the UK. For me, very interesting. It's not only recognized, but mostly reimbursed by the NHS system. Thank you very much.
Und jetzt möchte ich ganz herzlich nochmal Frau Nora Lappstein begrüßen, heißen bei uns. Und sie ist für mich eine echte Heilpraktikerin, als ich richtig verstanden habe. Sie haben das Wort. Ihr gehören in den nächsten 20 Minuten.
Takže paní Nora Laupsteinová, ona je opravdu, jak my tady jsme zvykli říkat, heilprakterin, léčitel.
This is Mrs. Nora Laupstein. She is a healer. I haven't met many of them, and I'm very happy to have her here.
So, dear Senator, dear Ms. Deputy, thank you for the invitation, Thomas Pfeiffer, and so on. It's an honor to be here in the Parliament. I'm coming from the European level, from the Association for Natural Medicine in Europe, and I was asked to present the situation of TCIM in Germany. So I would like to focus now in my speech the situation of practice. So next slide, please. The terminology in Germany is very different. We have traditional medicine, complementary medicine, integrative medicine, Naturheilkunde, which is a synonym for naturopathy, alternative medicine, biological medicine, besondere Therapierichtung, it's special therapies, and integrierte Versorgung, this means integrated healthcare. So in all those fields are working people. The workforce is working in this field. So next slide. And now, which professions we have in Germany? In the last 150 years, there's a development of a lot of professions which are dealing with the field of traditional medicine. First, the doctors. For natural medicine, it's an umbrella profession and includes the possibility of diagnosis. Then we have a doctor of complementary and integrative medicine. This is diagnostic, plus concentrated to the first market, to the National Health Service. Then we have a Heilpraktiker. It's an umbrella profession. It could give a diagnosis, and the Heilpraktiker works on the second market, so this is more the private health system. Then we have a sectoral Heilpraktiker. He's also able to give a diagnosis, but only for a special field, for example, psychology or physiotherapy or podology. So this is another one. Then we have the Geistheiler. It's spiritual healing only. He's working in the second market. They have a real union, and they are a very strong group. Then we have the midwives. They can work with complementary and integrative medicine, and they work on the first and second market. We have the nurses, complementary and integrative medicine, also in the first market, in the National Health Service. Free health professionals, with concentrating only on one method, like, for example, shiatsu or sound therapy, they are working with one method on the second market. Next slide, please. So the question is now about reimbursement and the insurance. The first market in the governmental health system, every citizen has to pay except liberal professions, civil servants, and those who earn more than 5,300 euro per month. TCIM can be reimbursed according a registration of doctors, all health professionals of the first market, and a special institute. It's the Gesundheitsbundesausschuss and the Quality Institute, IQWIC. They are thinking about what can be reimbursed, and they develop guidelines. TCIM has to be evidence-based or part of an integrated healthcare contract. And about 50 insurance companies are part of the first market. Then you have the second market, the private health system. Private health insurance companies accept the register of the doctors and the register of the Heilpraktiker, and they reimburse TCIM medicine and offer additional insurance for citizens. And the liberal professions and civil servants have full private insurance. This is interesting for those who work in the government. They are the civil servants, and they were paid also in the second market in Germany. Next slide, please. The German Heilpraktiker, what does it mean? I think the German Heilpraktiker is a very big success. Existence since 1869 with a possibility for an own diagnosis. This profession is founded in a time where the Prussia is in the north and the European continent has a complete other face. The German Heilpraktiker profession is regulated by law, and it's interesting that we have a free education, but we have an examination by the government. So this model it's a liberal education, and you can reach a level of mainstream medicine on your own way. And then you have to pass the examination. Examination guideline on national level by law from 2017. This was a guideline which was given to the regional governments for doing the examination, and it's including a strict procedure, do not harm and high medical level. Examination is carried out by a local health authority, so when you have your local health authority here in Prague, you have to go there and do the examination, for example. After passing this examination, the umbrella profession is legal. So this is important to know, that it's an umbrella profession, and you are not forced into one of the health healing systems, for example, TCM, Ayurveda, homeopathy, anthroposophical medicine. No, you can choose after passing the examination what is in your field, and you do the education afterwards and the training. And you start a specific education in the field of traditional medicine and practice. Next slide, please. Yeah, Heilpraktiker in action. It's a success story of competence in the second market. And this is a very unique position we have in Europe. And in general, most of the doctors or other people are amazed that the Heilpraktiker has such a long time and such a competence. About 10 professional organizations are organized on the Heilpraktiker level, and we now have a statistic of about 40,000 Heilpraktiker, including sectorial, in Germany. Trust and confidence of the patients, this is our daily work, and this is the result of a good and well-known work. Umbrella profession includes all holistic aspects and individual approaches. So here we find the true natural medicine, and the umbrella profession is open for individual research and individual experience with the patient, and so you can work one hand on the research, evidence-based results of research, and on the other hand you can use the traditional experience-based of the 1,000 years before. The knowledge of conventional and unconventional medicine is interesting because you know exactly where's your barrier and where you have to give the patient to another institution in case of emergency or infectional disease or those cases. Interdisciplinary partnership with all health professionals. So in the last 20 years, there are connections to all health professionals of the first and of the second market. And so this is the basis for an integrated healthcare where the first and the second market can work together. Keeping the wisdom and tradition as an intangible cultural heritage is a very important aspect we do now in the time of mainstream medicine, which develops in a completely technical direction. So for us, it's necessary to find the people where they are in their daily life and their social surroundings. And the work of a Heilpraktiker is a lifelong learning process. You learn and learn and learn the longer you work. Next slide, please. Research and science. We have individual case studies. We have congress events and experts. We have a development of a study design which fits traditional medicine. This is necessary because in our point of view, the study design which is used in medicine is another design which you use, for example, in anthropology, in history, in biology, in physics, and all those fields are connected with traditional medicine. It's not only medicine, mainstream medicine, it's another higher aspect of medicine. It's an art. Interdisciplinary exchange with biology, physics, chemics, anthropology, history, sociology is needed for this study design which fits for traditional medicine. We are not content with the design we have now, which is a basement for evidence-based. Integrative medicine favored by doctors and academics for becoming part of the first market and its reimbursement system produce a lot of evidence-based studies for safety and effectiveness. So this is, you have heard it before, this is one aspect, but what is with all those branches and therapies who are not rich, who have not the money, who have not the possibilities, who have not the researchers? It is very cost intensive and exclude those who cannot fit. It's exclusion. So after a time of all this study basement on this mainstream medicine, evidence-based field, we will lose a lot of traditional medicine branches. It should include experience-based and traditional use models. Please, next slide. Under pressure. What's the situation? In Germany, the skeptics movement influence politicians and the media. And in the last 10 years, it grows up more and more. And so the skeptic movements are very strong also in the field of the academia and the doctors. And the skeptics are, they are working in the field of digitalization, transhumanism, and on the other hand, they are really in favor of science, science, science. And they say only which is proved by science is existing. When there's no science, when there's no study, it does not exist. So very hard told you, if I look at you and I say, have you a proof that you are still alive? A study, a base of existence, evidence-based. You know, what's life? The precautionary principle for social politics, I think this is an error. Because the precautionary principle is based on the contract of Maastricht, and it's created for industry, for production, for economy. But 10 years later, it was implemented into the social systems. So also human beings now are suffering from the precautionary principle. And we have to think about what's the result of the precautionary principle. Documentation, standardization, certification, more and more of this stuff, and less time for patients, less time for work, so the workforce is suffering of that. And we have to think about this precautionary principle and give it back to the industry. The EU harmonizing process destroys regional speciality. So we have to be aware that the EU, which is driven by economy interests, is harmonizing everything. So we have to be strong to stay. The demand for personalized medicine and other modern conventional medicine as a standard of science and safety has to be discussed by the people, has to be discussed by the citizens of Europe. And because personalized medicine means that you are, as a human being, you are reduced to your genetic code. And the genetic code, a small part of it, and then they want to bring up a medicine for this, only for this. The individuum, what's the philosophy, what our talents, fantasy doesn't fit, it's only genetic. So we have to think about the ignorance of the complexity of traditional medicine. This is an ignorance, is a problem, because the solution, the possibility, which is here on Earth, with nature together, since thousands of years, it's ignored. And now the human beings think they are so clever, but I think we have to learn a lot of nature. No grants for research. You have in Germany now 30 million euros for the gaming industry to develop gaming and computer plays for the youth and so on, but not a single euro for research in traditional medicine. Imagine. So this is a sad affair. This is really a sad affair. More stronger regulation for TCIM medicinal products and food supplements make it more expensive for patients. Yeah, they say now it's safety. Yes, safety, safety, safety. We are so safe that we cannot move from the right end to the left, because a stronger regulation, for example, for homeopathic medicines, for all the food supplements now, it's in discussion for Hypericum folatum, for maca, for all herbals, that they are not safe. They have to bring up evidence base for safety. And the Paracelsus knowledge of the dose it makes, if it's a poison or not, this is forgotten. It seemed to be forgotten. Undermining the power of nature and the environment. Yes, this is a pressure we have now, and we have to think about that. Next slide, please. This is my idea for you from the practitioner, from the workforce side. And I think it's necessary for the national parliaments to deal with it and to bring up a real TCIM expert profession. We need this expert profession, and it doesn't matter if it's a doctor, it's a non-doctor, it's a traditional healer, and it does not make sense to make for every TCIM branch a profession. No, we need an umbrella profession as a CAM expert, a TCIM expert, because the people are asking for that. They need it and they want it. And so we have to create in every national European state, according to legislation, or to create a new legislation, that we need this CAM expert where the people can go, because a mainstream doctor has no time, no money, and has no competence to do that. So this is my speech for you. Thank you very much.
Frau Laubstein, haben Sie ganz vielen Dank für diesen sehr interessanten Vortrag, und es ist ganz wichtig bei uns zu wissen, was die Gesetzgeber machen sollen, um diese Methoden durchzusetzen zu können. Ja. My děkujeme velmi, paní Laubstein.
Thank you very much, Ms. Laubstein. It is very important to learn how to arrange it to be able to pursue these methods in the Czech healthcare.
Da noi a lei ha la parola per prossimi 20 minuti. Grazie.
Grazie. Okay, thank you for inviting me, for the kind invitation and warm welcome in Prague. Now I would like to ask you to stand up, please, and prepare to give a big applause to a very important person that is entering this room now. So please, if you can stand up for a... And this very important person that is entering this room is you. You, that you, you are listening for a long time. So a big applause to you. Thank you so much. Thank you. So now I can start. Okay, my name is Federico Palla. I'm a coordinator of Salus Network, and my speech today will on three topics. The first one, regulatory context of TCIM in Italy. Then I spend some words on some proposal of Salus regarding this matter, and at the end some words also about what is Salus initiative. Okay, first of all, we have to have in mind that there are a lot of TCIM professionals in Europe. We have some data there. 65 TCIM professionals per 100,000 inhabitants. That is a considerable number compared with general practitioners that are about 79 per 100,000 inhabitants in Europe. And in Italy, in 2013, we had around 5 million people who use TCIM treatments, especially homeopathy, manual treatments, phytotherapy, and acupuncture. And we experienced in Italy a wage. There was a peak in 2000, so there was a growing interest in TCIM, and then there was a lowering till 2013. Then I will come back on this data this year, that it's like a turning point. Why? There was a peak, and there was a windows of opportunity to make a law in Italy about TCIM. And after 1997, there was a resolution of European Parliament on this matter. There were a lot of proposals of law in Italy, in the Italian Parliament, and all failed. And there was a contrast with, especially with medical doctors, with representative of medical doctors, and a part of this representative that Nora called the skeptical movement. So we had already also in Italy this kind of contrast. And in this period, medical doctors claimed TCIM for themselves, all this for themselves. And there were interesting experience, like in Tuscany, there were the first integrated medicine hospital in Pitigliano, Tuscany. And a survey on 2006 revealed that there were at least 140 public complementary medicine centers in Italy, with acupuncture, homeopathy, phytotherapy, and manual medicine. So, as I mentioned before, important science opinion leaders try to stop the regulation of TCIM in Italy, and to claim also only for sanitary system for medical doctors. And so we experienced this strange division between medical doctors and other professions. But in 2013, we had a law, number 4, provisions on unorganized profession, that was very innovative, and it was a framework and a regulation to professional activity that were not covered by reserved area like sanitary professions. And these include also TCIM professionals. And this law is based on standards. You know, standards like the UNI, ISO, like technical standard that are we usually see technical standard in, I don't know, the fridge and the oven or cars, but also for professionals that can be technical standards. And so the philosophy underlying this law was that of ensuring recognition not based on reservation, exclusivity, register orders, but on active role of professional association, representative of professionals, with that technical standard. And so it is a soft law that delegates the task of regulation to the market, to the professionals. So the law allows professionals to define themselves, their regulation, their standard. This is very interesting. And under this law, the first standard was that of naturopathy. So there was the first time in Italy that we have a standard on naturopathy. That is obviously a part of TCIM. And also for holistic massage. And the law is based on standards and on accreditation and certification of competencies of these professionals. There is a risk because there's no obligation to be accredited or certificate, and so there is a risk for citizens. So in Italy, we have a lot of naturopathic professionals that tells, I'm naturopathic professional, and they have 3 weekends of education, okay? So it's the citizen that has to find out which kind of education has this professional, okay? And so it's up to the association to give more information to citizens, to be able to raise awareness on citizens about these kind of professionals. And we had also, prior of this law, we had a regional law in Lombardy, where there is Milan, nearby my house. And this regional law recognized a big area of bio-natural disciplines. So it was the first public register in a regional, at a regional level that recognized this kind of professionals. So it was like more, it guarantees citizen, okay, of the quality of these professionals. So the national law, number 4, and this regional law combined can guarantee more citizen. Regarding the regulation of naturopathy, the standard specified knowledge, skills, and competencies in accordance with the European Qualification Framework, EQF, and also describe what products they can recommend to the persons, the treatment they can perform, the equipment and the devices they can use, and so on. And for instance, in this standard now are banned terms such as patient, diagnosis, prognosis, therapy, treatment, prescription of drugs, the prescription of detailed nutrition plans with calories, calculation on daily menus, treatments such as that are invasive, like bleeding cups, bauxite, cantharid patches, and leeches. And what is unclear is the possibility to suggest phytotherapeutic and homeopathic products. Why it is unclear? Because the other side of the law is that association can decide themselves the standard, but any other association of other professionals can intervene in this process. And so what happened in Italy 2 years ago is what herborists, they want to intervene in the process and told, no, naturopathic professional, they can't suggest phytotherapeutic. And they blocked the process. So we are facing this block now, hopefully. And this is why there is an equilibrium. So the professionals can intervene transversally on the standards if they see that there is the risk to have competencies over our area, okay? So again, there was a contrast in this case between naturopaths and other professionals, the herborists. So, second topics. What are the proposals of Salus? We want to to solve this division. We want to overall divide divide et impera, that is Latin, divide et impera motto, so not to divide professionals. This is very in line with the title of this meeting. It is time to cooperate. It is time to, in Latin, compone et collabora. Okay, unite and collaborate. And so Salus, the logo is a bridge, because it's a bridge between philosophy and science. So not only science, not only evidence-based, we need also other kind of knowledge that are traditional knowledge. Between reductionist and holistic view, health and environment, health promotion and care, practitioner, conventional medicine, and TCIM practitioner, and so on. So it is important now to focus on what is very essential, that is health and not disease. And we are asking, especially at the European level, for a standard of training for health promoters. So Nora mentioned the importance of an umbrella professional, and we would like to have a bigger umbrella of health promoters. So not only an integrative medicine that is focused on the cure, but be very focused on health promotion. And we think that in the field of health promotion, we can collaborate, doctors with naturopaths, with other professionals of different kind. And this, we are managing this in two levels. The bottom up, so starting from a national context like this one, in November we'll be in the Senate in Rome, and so we would like to work with governments, with parliaments, in order to suggest legislative actions on this matter, and also from top to bottom, so from the European Parliament, where we have representatives. And now I end with the third topic. What is Salus? In Italian, what is? Salus originates from an intentional community called Lumen that was founded in 1992 in the northern of Italy. It's an eco-village. It's a community, intentional community of around 60 persons living together and practicing healthy nutrition, physical activity, deep relationship, meditation, and other holistic activities. So it's a living testimony of the benefits of this choice of life, health promotion, and environmental sustainability. And we practice also different traditional medicine, like Chinese, Ayurvedic, and European and Mediterranean. The idea was conceived by naturopath Milena Simeoni in 2019. And we started with a big event in the European Parliament in April 2019. We have a European network where there are also ANMI and TCIM. We have a scientific philosophical committee. And what has been done since 2019? We made conferences in the European Parliament, in national contexts like Italy, Spain, Germany, Switzerland, Czech Republic, and France. Online conferences. We made a position paper, the European Manifesto on Healthy Longevity, a book on COVID, suggesting different, how to integrate health promotion in the COVID strategy of containment. We made a bill in Italy for intentional and sustainable communities for the recognition of this experience. And we suggest a lot during the COVID period, because we was born and there was COVID period suddenly. And so we made suggestions, and up of 80 recommendations that we sent, 3 were included into the Special Commission final report on COVID that was adopted in July of last year by the European Parliament. And where this one, the acknowledgement that there is a lack of health promotion, the view of COVID as a systematic problem linked to healthy lifestyles and pollution, the need to coordinate a European health promotion strategy. We are involved also in research in northern Italy with a public hospital with a study, a randomized controlled trial on naturopathy and migraine. And we are working with different networks, such as 10 Forum. A few days ago, we were in Vienna for the 10 Forum, the second 10 Forum. And we have support from MEPs, members of the European Parliament. So we started with Eleonora Evi, and then Rosa D'Amato with an interest group in the European Parliament with 9 MEPs of different parties and different nations. And for this election, we received an endorsement from 26 candidates to the European elections in 10 European countries. And we present the European Manifesto for Healthy Longevity. And there are 6 sections area on this manifesto. First one, improve quality of what we eat, promote physical activity, promote deep social relationships, conserve and restore natural environment, promote practices of self-listening and inner growth, promote an integrated and personalized approach to health promotion. And we made some proposal to the European Parliament, in particular to establish, and we are working on this in this month, to establish an intergroup stable on healthy longevity inside the European Parliament, where different MEPs from different countries and different parties can be together and decide proposal on this matter. But we also propose this in Czech Republic, in Italy, in Spain, in France, because it is very important to create this kind of bridges also between political parties in order to make proposal for healthy longevity and go on with this matter. So next event, we were in Vienna. We are here in Prague, and we will be in Rome in November with an international conference called The Centrality of Health Promotion for a Healthy and Long-Lived Society. So a paradigm shift is possible and is needed now. We have to focus on health promotion. So thank you so much for your kind attention. Thank you.
Tante grazie, Signor Palla, tante grazie. And now, the last but not least, Mr. Amarji Pamra, how to cooperate in the UK between the traditional Indian medicine and the Western medicine which is practiced in the UAE and the UK. It's up to you. You have your next 20 minutes. Takže pan Amarji nám bude vyprávět o tom, jak kooperovat
Mr. Amarji will tell us how to cooperate in Western Europe, especially in the United Kingdom, cooperation between traditional Indian medicine and Western medicine, because United Kingdom has always been closely linked with India.
So, thank you so much. Ayurveda says that the body is a book that must be read daily. So this is just a little question I'm asking of you to think through while I'm speaking, and at the end of my presentation, let's try and work out what is that Ayurveda wants you to read every day. So again, the question is that the body is a book that must be read daily. So how do we read this book? So first of all, I want to thank Madam Parliamentarian Brigetji. Thank you so much, for hosting, and congratulations on this magnificent audience and the speakers, the panel of speakers, absolutely wonderful. Thank you so much. And we are here gathered, all us beautiful souls gathered here for a reason at this beautiful country on a beautiful day in this beautiful parliament. And so the idea is that how do we, from my perspective, what I'd like to share with you is that how do we move forward? How do we educate the hearts and the minds of the parliamentary and the policy-making community to accept what we do? We are all here, we all understand complementary and alternative medicines, and there are various names that we have been sort of speaking about that cover this area. And so the word that we have in Ayurveda and in yoga is Ayush. Ayush means perfect health. So when we look at health in Ayurveda or Indian sciences terminology, we look at Ayush, which means perfect health. When we look at the word health in the West, so we look at disease. Yes, that's the main difference between the approach of Ayurveda and Indian traditional sciences versus what we're doing here in the West, which is the allopathic tradition. So the government of India also have set up, they have a department, they have a Ministry of Health, but they also have a Ministry of Ayush. Ayush is also an acronym, which is A for Ayurveda, Y for Yoga, U for Unani, S for Siddha, and Unani and Siddha are also traditional medicine systems of India like Ayurveda, and H for homeopathy. So we have back in India a Ministry of Ayush, which specifically focuses on these modalities and how to encourage people to have access, for people, the population can have access to this. And so it was back about 10 years ago that the European Union, brought about a sort of a not so nice directive, and it was to do with the annihilation of traditional and herbal medications in the European Union. And that's where we picked everything up. And so immediately we set up back in Britain. Although my lineage is from India, my grandparents are from India, I'm born in Kenya, and for the last 50 years, I live in the United Kingdom. And I belong to a very powerful family, a Sikh family of Ayurvedic physicians. So it was about 10 years ago that we set up a meeting in the British Parliament to actually discuss the possibility of whether you talk about, the traditions in Czech Republic or in Italy or in Germany or Peru or India, we all have our traditions. And so these traditions have saved our generations. And there was no paracetamol then, huh? There was no antibiotic. So your grandparents, my grandparents, how did they have a wonderful life and a healthy life? So the idea was that where all these traditions have been saving, our forefathers and our foremothers, and those systems have actually been put under a microscope through the biggest political machinery that we have in Europe, and they said, sorry, you can't have this. So we then, as I said, set up a campaign meeting in the Houses of Parliament. So like you, we also have two houses, Houses of Commons and Houses of Lords. And at that time, I remember quite vividly, it was in November 2009, that when I say I don't want you to please misunderstand that I'm speaking from my ego, yeah? So I had the opportunity to bring all the traditions together, not just Ayurveda, not just yoga, but Chinese, Tibetan, Japanese, Aboriginal systems, African systems, even the Western herbal system. And what I found was that there was so much diversity in the sense that, many organizations were actually, not getting on with each other, but representing the same modality. So it was a very arduous, it was very difficult, it was a very challenging task to bring everybody together, but it happened. And then we started the campaign to make the establishment understand that we need freedom of choice, yeah? So you see me here standing with my turban, yeah? So in England, and I live like this. There are people in England, who are vegans. There are people in England who are not vegan. There are people, who, if you want to dye your hair blonde, you can do that. If you want to be brunette, you can be a brunette. So there's freedom of choice. When it comes to our health and well-being, why must there be only one medical system? And so, ladies and gentlemen, we embarked on this path, and within a matter of about 3 to 4 months, we generated over 1.5 million signatures, which we then presented to the government to say to them that we need freedom of choice in our health and our wellness. And you'll be extremely pleased to know that, if you don't ask, you don't get. And that is why we are here today. If we don't ask, we don't get. So we have now a situation that, after lobbying the government, that, and we have now a possibility to import into the United Kingdom fresh or dry herbs which we use for medications into the United Kingdom. Because although at that time the United Kingdom was party to the EU, but obviously what the EU does, it passes all these directives and everything, but it leaves the policing of the directives individually to the 28 nations. And so the UK opted out of that, and so we are a very happy country. Now everybody's having wonderful treatments, and Ayurveda is flourishing. And, but the journey isn't finished. So we then, some very senior parliamentarians who were part of this program, like Margita. Is that okay for me to say Margita? A parliamentarian here. Some very senior parliamentarians in the UK. So they then decided to put together a group, and that group is known as the All-Party Parliamentary Group on Indian Traditional Sciences. So the Indian Traditional Sciences are what I just mentioned to you at the beginning of my, what I'm trying to share with you. So it's Ayurveda, Yoga, Unani, Siddha, Jyotish. Any idea what might Jyotish be? We use the astronomy and astrology for health purposes. Yeah? So, which is our closest heavenly body to us here? Which is our closest heavenly body to Earth? Moon. Does the moon have an impact on the Earth? Yes? And that's it regulates the tide, yeah, the oceans. 70% of the water on the planet is water. 70% of the planet is covered with water. How much water is inside your body? 70%. So there is a definitive impact of the heavenly bodies. So So, you know, that we take into this consideration. And Vastu. Vastu is what you might call here environmental engineering. Yeah? So it's like, which way should your head be when you go to sleep? Where should the kitchen be in your house? Yeah? So these are all Indian traditional sciences that we work with back in the United Kingdom Parliament. And so, ladies and gentlemen, we have a very powerful group of 30 parliamentarians from the both houses in London, from all the political parties, and this is very important, you know, from all the political parties who have come together and who are thinking through to see how can we, you know, break down the barriers, you know, that there are, and actually try and, you know, accommodate the freedom of choice, you know, for medication and medicine systems, you know, in the health architecture of the United Kingdom. So that's the journey we're on. And I mean, I was doing some presentation yesterday with my very good friend, Federico. I'm not going to go in there now because it'll take a lot of time. They've gone through a lot of the, and my very good colleague there, John, he's gone through some figures with you also. So I just really want to stay focused on the political angle. And this is what makes, you know, will make the difference to our meeting here. So we've said, we've been having, you know, meetings every quarter in the House of Lords or in the House of Commons to educate the parliamentary community. So your parliamentarians who are here today, they need to be educated. You have to tell them in their language that they understand because, you know, they're a little bit different, yeah? So you have to explain to them in their language so they can understand what is it that we want. So we can't say here, okay, well, you know, this is what it does, and this was started 250 million years ago. Yeah, but we have to be very sharp and concise and say, this is what we want, and this is how, you know, please make it available to us. And with that approach in England, and we now have yoga, which is part of the National Health Service. Yeah? So we have another trial going on, which is, unfortunately, as you saw here, even in this country here, so many people, unfortunately, died from COVID, yeah? And so many survivors, you know, who are still suffering from long COVID, a mental disorder, you know? And so in the United Kingdom, the National Health Service, they estimate there are 5 million people living with that condition. No solution. So now, with the grace of the universe, we are working on this program supported by the Government of India. Yeah, this program supported by the Ministry of Ayush, Government of India, working with the UK health authorities to see how Ayurveda, a particular Ayurveda herb can have an impact on long COVID. And this clinical trial is led by the London School of Hygiene and Tropical Medicine. And the idea is really to engage 2,500 individuals who are suffering from this and to see, you know, what evidence we can generate. Yeah? And so these are all the impactful things, you know, that have the only way, I think, and I might be wrong, but I think the only way really is to come here, because these are the people you have voted for. Yes? Yes or no? Your parliamentarians who are here are because of you. So you have to ask them, you know, what are you going to do for my vote that I've given you? And we've done, and you know, the whole, I mean, as I said, you know, day by day, week by week, month by month, year by year, the awareness amongst the parliamentary community is increasing, the policy making, and the most important thing is that the people, because we are just in between, yes? It's the people who, you know, I think most of you are practitioners here. You are just, so imagine that, you know, there is a petrol station, and you've gone there to put some fuel in the car. And there's a car there, and there's a petrol pump here. Where are you in that? Come on, let's do it, let's go. Where are you? Where are you? Are you the pump? Or, you know, the pump, you know, where the petrol is coming out of. Is that pump? You call it pump, yeah? Something like that? The pump, you know, where the diesel and the petrol is coming from. And there's a car. So we are all not the car, we are not the petrol pump, but we are the hose pipe. We deliver the treatment. We had very extraordinary speakers here talking about all the success they have, you know, with acupuncture, with homeopathy. So we are just delivering the treatment. So at the end of the day, it is all the work, you know, why we are here is really for 10 million Czech people, because they want this treatment. They want safe treatments. They want non-invasive treatments. And how do we do that? By raising public awareness. So please, in future, when you have meetings like this, and I'm very grateful that, you know, my very learned colleague, Thomas, you know, he came to one of our first meetings in the European Union Parliament. So we are also engaged with the European Union Parliament since 2017. And we have regular programs there. The idea, again, is to educate the European members of Parliament, you know, for the virtues of the you know, people speak about prevention is better than cure, yeah? You have all heard that? So what prevention are they giving us? Where is your prevention here? So if you really want to talk about prevention, preventative medicine, we have to talk about, you know, complementary and traditional medicine systems. And so, are there any questions? So it might be, I think, whatever I'm saying right, yeah? So everybody seems to be okay. So can we, please support, you know, parliamentarian Margita in future meetings like this. I want to give her, she has actually come to our program, you know, via Zoom in London, so she already knows, you know, what we're doing back in London. She has seen our programs, you know, that we conduct in the Houses of Parliament. And I want to extend a humble invitation to her and all her colleagues here, you know, who are from the chamber here, from the parliament here, to please come and see how our British parliamentarians are working. Thomas has been there, Ludmila has been there, Margita has been there, and so many people, they have been coming to the programs, you know, year after year after year. And I'm very happy that I've been invited here, not to just speak, but to support this initiative, you know, to see that we also have an interest group in the Czech Parliament, you know, to advocate traditional and complementary medicines, because if we don't do it, ladies and gentlemen, there will be no legitimization. So our journey is for legitimization. How do we legitimize this? And I'm awfully sorry, there is a wonderful lady sitting here, I keep forgetting her name, and she was also with us in our meetings. Thomas, what's her name? The lady sitting there with the blue. Yeah, thank you. So she has also been, so she was there in the very beginning, you know, when there was representation from the Czech Republic. So thank you for your continued support. We have wonderful memories of you. And so we have, so our drive is not just about to say, oh, Ayurveda is the best medicine system, or acupuncture is the best system. We must not fight amongst ourselves. No need to do that. We can have a family and 2 children in the family don't eat the same food. So we don't need to fight with each other. We need, if we're talking about integrated, we need to integrate ourselves first. And the second most important thing is that we all must speak with the same tongue when it comes to the politicians. We all, whether you are practicing shiatsu or you're practicing reflexology or whatever modality you're practicing, we all have to come together, and my colleagues who've spoken before me have been saying that there are overarching organizations, and so we need to be part of those organizations. We all need to be here in Czech Republic, have a united voice so that we can speak with the same tongue, so we have our message is clear. And of course, the other thing is that we have to take a high moral position. Yeah, high moral position. That means that we don't go and say, oh, my system is the best because I've been doing it for 15 years. No, we have to work with the modern medicine. They are doing some very fabulous work. They are doing some great work. We have to acknowledge that. In the Czech Republic, you see an ambulance, yeah? Ambulance? You have a pharmacy here. Outside the pharmacy, what symbol do you have? What symbol do you have? What do you see outside the pharmacy? Snake. Snake. Yeah? What is a snake doing outside the pharmacy shop? And you see the same snake on the ambulance, on the side of the ambulance, painted, not the real snake, yeah? So it's painted. Why do you use a snake?
Ancient symbol of medicine.
Pardon me?
It's an ancient symbol of medicine because they used to take out parasites with this special kind of wooden tool.
I would agree with you to a certain degree, but that is the original symbol of Ayurveda and yoga and Indian traditional sciences, which is known as Kundalini. So you see, our friends, all your Krankenhauses here in Germany, in Italy, and here, they're all using the system, and that's why Ayurveda is renowned as the grandmother of all healing systems. And I think we have to see that what the modern medicine have done, it's a development. So we must work with them. There are areas where their medicine system is critical and that our systems may not work as brilliant, and vice versa. So we need to take a high moral position and offer our hand of friendship and say, come on guys, we all want to work together. That is the way to work forward, and that's the approach we have in the UK. So we are trying to all the time, engage with so many different associations. John mentioned NICE, National Institute of Clinical Excellence, and MHRA. MHRA are the policing authority for all the drugs that have to enter into the UK. So the trial that we're doing, for long COVID is actually sanctioned by MHRA, and it's actually a medical trial and not a supplement trial. So if we don't work, if we don't have an agenda, then we're not going to get anywhere. So I'm really glad that, so many of you are here from so many schools of thought, from so many different, healing modalities. Please don't lose this opportunity, because this time will never come back. Yeah. And finally, if I may just say so that tomorrow is the longest day of the year. After tomorrow, the days will start getting shorter, Yeah. So I want to please invite all of you through Thomas. He can give you the link. He will be on our website. So we are celebrating the International Yoga Day tomorrow, which is United Nations International Yoga Day tomorrow. We start at 3:30 and we finish at 5:30 on Zoom. So thank you so much. I'm absolutely privileged to be here with you. And I really do hope to see you in the Parliament in London. Thank you.
Thank you very much. Thank you really very much. Takže já bych tímto rád ukončil blok přednášek.
This is it for the second unit of presentations. This was quite demanding to sit and listen for 3 to 4 hours in various languages. This is really an achievement. My students wouldn't be able to sit through so long. Thank you for your patience. I'd like to thank all the speakers, both Czech and foreign. And I said that everyone has 20 minutes. Now it's your time for questions and answers. You can raise questions to our colleagues, Mrs. Bendová. You need to speak on the microphone. I would also like to thank very much for organizing this fantastic conference, Mrs. Bendová, for all the work of Professor Fiala. I have a very short presentation, if I may ask you for 5 minutes. These are specific data obtained through evidence-based methods. Unfortunately, Mrs. Křížová is not here with us. She's been doing complementary integrative medicine for 30 years, and she said that such results that have been achieved by traditional Chinese medicine are really very unusual. She hasn't seen them anywhere. Professor Fiala said that for this point, LU7 on your wrist, all the Czechs should know it. Even though I'm a medical doctor, I represent non-medical doctors. I do traditional Chinese medicine. I had this unique opportunity to meet an ancient practitioner who is coming from a generation, I think, about 10 generations of his family were experts in traditional Chinese medicines, and he and I have founded the traditional ancient Chinese medicine, which is closely linked to Ayurveda. I'm very happy that our Indian colleagues spoke here, because they also focus on constitution. This is the difference from conventional medicine. When you prove a streptococcus, everyone gets the same antibiotic, but in traditional Chinese medicine and in Ayurveda, you always focus on the individual situation, the individual body. Everyone gets different herbs. And this worked very well at the time of COVID. I'll be very fast, don't worry. What you will see in a short while are the results of the third sociological study in patients of traditional Chinese medicine. There were 2 studies in 2005 and 2009 in only 100 patients, conducted by students as their final studies. You can see that the percentage of happy patients was more than 88%. And the next study in 2018, a very scientific evidence-based study, thanks to Assistant Professor Křížová, who's been doing this research for 30 years, and she is giving lectures all over the world. Anyone who is interested may look it up on the website of our school, www.tcm.cz. It is important that you see the charts. The study wanted to find how the patients evaluate traditional Chinese medicine, how they see their treatment. let's skip this. I want to show you the charts. You can see that 3/4 are women, 1/4 men. Now here, this is an important chart, pie chart. When talking to the best experts from the Western and Czech medicine, we hear that traditional methods of treatment like Chinese medicine, Ayurveda, or Tibetan medicine is only conducted by low IQ and uneducated people, while here you can see that 46.5 people had university education, 40% had middle education with school leaving examination. So these were not uneducated people. This is age distribution. You can see for yourself. 18 years was the cutoff point. We also work with children, but not for this study. We started with 18 years old, all citizens of the Czech Republic. Here you can see the range of problems treated, length of treatment, go on. Whoever wants details can look it up on our website. Time of persistence of problems in patients, go on. This is interesting. Who recommended traditional Chinese medicine? These traditional medicines and Ayurveda are not promoted by media in general, especially in the last 10 years. So who recommended Chinese medicine to you? You can see mostly friends, neighbors, family. Methods applied. Traditional Chinese medicine is a long-term, is an ancient animal. Acupuncture, phytotherapy, tea, phytotherapy. There is yin and yang, and old writings. Our first school of traditional Chinese medicine is based on this. Our first professor was a Buddhist, so he practically never used any medicines of animal origin, and we still use the same therapy. These are the systems used. Everything based on philosophy of Chinese medicine. Are you thinking about terminating the treatment with Chinese medicine? This is not covered by health insurance. People had to pay for everything. Here, the interesting factor, why do you want to terminate the treatment? Because my health improved in almost 70%. Concurrence of Chinese medicine and conventional medicine treatment. Sometimes they are telling us that we cannot boast with good results if they were achieved by conventional medicine. Once again, Professor Ayurveda, our Indian colleague, my pre-speaker, said that in China and in India we can see great concurrence of both methods that are complementary to each other. We've also heard it from other speakers. You can see that in 68% people at that time, they were treated only with traditional Chinese medicine. And here, this is the last slide. The question, were you helped by traditional Chinese medicine? Certainly, yes. 77.2% said yes. I was really shocked because I don't think that even in my own medical practice, I've been doing it for more than 30 years, my results would be so good. Yes, further 13.5% people, so more than 85% patients were happy with the treatment. I'm saying this because I hope that there may be some parliamentary deputies or people who run this country. You can see that these methods are useful, that they are worth researching and supporting, and government funding. This won't cost you a single crown. All this care is paid for by the patients themselves. I think that already the health minister Rubáš delisted acupuncture from treatments covered by health insurance. This is it from me. Thank you for attention. Sorry for the time taken, and I'll be available for any questions.
Thank you too. We received several written questions, so let me start our block with it. There are questions for Mr. Pfeiffer concerning the principles of biotronics and how much does it cost? No microphone, sorry. Biotronics is always free of charge, but that's not an example you should follow. It is a treatment that really abides by this principle, and the patients never pay any intervention. We work with organic and inorganic matter. We know organic matters, all radiations, electricity, gravitation, and so on, while the organic matter is very different. Piece of coal and piece of carbon. So what's the difference? Complexity of their structure. So we need both organic and inorganic structure. The organic force, organic matter is much more complex, and knowing these links, relations and structures allows us to target on processes and points in a body. It's one of the modalities, and you should always go to a doctor. If there was no oncological treatment applied, it was the decision of the doctors, not our decision. So I answered all of the questions that were asked. Thank you. I want to add that, of course, it costs some money, but it's a voluntary contribution for the treatment, and it deserves a big round of applause, because pharmacological companies only want to earn money on us, but this man wants to heal you.
Ano, tamhle další.
Yes, no microphone, sorry.
K mikrofonu, prosím.
Já vám přeju krásný den.
Hello, good afternoon. I want to share something with you. We heard many thanks for Ms. Balaštíková, for the senator, for Professor Fiala, but no thanks for a person without whom this conference couldn't be organized. And not only this one, but also the Congress of Health, which is regular. Tomáš Pfeiffer, thank you so much for everything. And we should extend our thanks to all presenters, because unfortunately, I'm one of them, because I've been a kinesiologist for 30 years. I will not make any presentation because we were to be presented 3 alternatives only. We also received a presentation on Chinese traditional medicine, which was not the plan, but it was good to hear. So all of us who are here, please be aware that we can bring very many benefits to the whole society. Thank you very much.
Děkujeme pěkně.
Thank you. And back there is a question. No microphone, sorry.
A pak tamhle paní v bílém, ano. Když tak pojďte blíž k mikrofonu.
And the lady in white. Yes, good afternoon. Short message for you. I am a GP. I work with energy medicine. We know from quantum physics that there are not only particles but also waves, and I want to say that everything that was said here is based on a common fundament. This is wonderful, and I'm thankful for the results that were presented. Patients in the outpatient wards ask for energy medicine more and more in all of its forms. So we as physicians, healthcare professionals are certified. We are certified abroad and in the Czech Republic as well, thanks to Professor Fiala. So I want to support you. I want to continue my work, and I would like to ask you to make it official because I want to continue.
Dobrý den.
Hello, my name is Olga Shera. I am a psychology in healthcare psychotherapist. I work in a psychosomatic clinic. I've been using homeopathic treatment for 12 years, and I also want to mention yet another aspect that is important, and that is connection between homeopathy and psychotherapy. It generates wonderful results. I don't have these wonderful charts and dashboards, but it reduces the psychotherapy to 1/3. Homeopathic treatment is able to remove deep blocks, and psychotherapeutic treatment processes it, gives it a content, and works with trauma. I specialize in deep trauma, and connection with homeopathic treatment is really wonderful here. Diagnoses like depression or anxieties, panic attacks, which is anxiety, of course, can be resolved much faster if we engage homeopathic treatment. It is an epidemic of such anxieties now, and it's not an official term, but the disorders of autistic spectrum, we can see a peak now, and homeopathic treatment generates wonderful results. When a 5-year-old child started to speak within 3 months, child that never spoke before. The child spoke in whole sentences and understood what he or she was saying, which is not obvious. So I wanted to share this with you because this is critical, and it's important for the whole society. People are healed, and it's good for the economy as well. They are not on a sickness note. I mean, sickness note for a person who burned out last several months, and the child that is healed. I mean, that's very important. It's a long-term effect. Thank you very much for a wonderful conference.
Až neuvěřitelně, že se to děje, tak.
It's unbelievable that such a conference can take place. More of such events. Thank you very much. Dr. Šlemínová has the floor. those of you who are attending, if you're interested and if you are medical doctors or you work in any of the fields that comes under TCIM or CAM, please let me have your email or phone contact. I will make use of it and approach you later. Thank you. My name is Margareta Šlamínova. I have a question to Dr. Váňová. Do we have any information about how the general public is interested in complementary medicine, homeopathy? Do we have any data? No microphone. No microphone, sorry.
Protože v naší homeopatické
In our homeopathic medical association, these figures are monitored by Lucie Nestrašilová, so I will give her the floor. Good afternoon. My name is Lucka Nestrašilová. I run the portal of the World of Homeopathy and of the association. The website is seen by 26,000 unique readers per month, and we have very strong presence on social networks. Again, 26,000 on Facebook, but the outreach is about 100,000 users per month. We've been having Instagram for a short time, 2,500 users. We have a great application of homeopathy, which provides fast advice to people who need the advice how to use homeopathy. This has been downloaded by 9,000 users. On Google, homeopathy is looked up by about 15,000 users. And I have to agree with Dr. Bendová, who spoke about the research regarding traditional Chinese medicine. We also conduct such research. We have very similar figures on homeopathy. And I can confirm, based on a long-term aspect, these are mostly university-educated people or people with mid-level education, but the education is very important because these people are interested in integrative medicine. The same applies to homeopathy, and the age structure mostly it's women who are interested, who look for this method. The age 35 to 50 years is the key age group, 90%. Of this age group, besides Instagram, which is visited by younger persons. Thank you. And the demand for erudite experts in homeopathy goes hand in hand with this. I see this quite often, that the patients seek a homeopathic doctor. Physiotherapists also know homeopathy and are interested, and the bottom-up demand is much larger than what us medical doctors can offer. So there's a question how to organize this society to support homeopathic education, because homeopathic therapeutic method requires education. You have to learn how to prescribe homeopathic medicine, and we do have an education system, school for pharmacists, nurses, medical doctors, midwives. We do have certified experts from international school who know how to teach. So we need to cover the demand from bottom up, people who want to take their health into their hands, want to use homeopathy. They want to have the possibility of choice. And they have the right to be correctly informed, because I can choose a therapeutic method only if I know about it. If I don't, then I may give in to some fake information, and there's a lot about that, a lot of that as well. So look up World of Homeopathy in Czech, which provides all kinds of advice to doctors, experience from patients, and when people look up their portal, and they may also receive an answer that their question exceeds the potential for a telephone contact, they find it very hard to find a homeopathic doctor, and that should change in future. Lack of education of medical doctors has to be supplied over the internet, and that's not the right way to treat people over the internet. So we try to avoid that. We can offer fast advice, but it is difficult. It would be much more useful if medical doctors and healthcare professionals got more education in homeopathy. Thank you. Next. I apologize. Last information from me. This January, a study was published that dealt with a certain type of herb, Astragalus mesocalus. It was found that this is a longevity herb, as we can see in old text, but it has highly positive effects both in fatigue syndrome and in long COVID. Astragalus. I have a few patients with this diagnosis, and they are very hard to cure. I have made some tests with this medicine. There are results. Of course, time plays a role. It may take some time, months or years. Thank you. More questions? Please come to the microphone. In the meantime, as I can see the debate, this is a debate of those who are convinced already, and they speak to other people who are also convinced. I'm very sorry not to see more parliamentary deputies besides Mrs. Balaštíková. I saw Professor Válková. She is a deputy, parliamentary deputy, and she's a medical doctor as well. Good afternoon. My name is Marcel Kvapilova from Czech Craniosacral Association. I have two questions. You said that there is a working group which has been in operation for 1.5 years. What is the next procedure? What can we hope for? And then my second question, there was a research study regarding fields and other possibilities. Have you also included craniosacral therapy? Thank you. This group has been in operation for a long time. It is our goal to proceed in this work, to maintain cooperation with the Ministry of Health and perhaps with Ministry of Education, and to make sure that these fields will be taught at universities, so students who will become medical doctors once should receive this information already during their university studies and not from the internet. And the Ministry of Health should also inform patients about this, and the cooperation should be much more complex and hopeful. It is a long journey. I cannot promise results within the next 6 months, but the room is being opened. There is demand from patients. They do want the possibility of choice, and I believe that the doctor's goal and task is to cure the patients, so medical doctors should be interested as well. We want it all on an expert technical platform. We want to have this secured by legislation. It should be made legal. Of course, we want all this to be legal, in line with legal regulations. It would not be fair if it was not, and we have to also break the disregards of certain medical doctors who only see conventional medicines. And it is good that we have foreign speakers here, because they are telling us about their experience. They've been fighting the same struggle, and they have gone a long way already, and it is good to hear from their experience. The current chairwoman of the Health Committee is very friendly to this, and she will not be against deepening this collaboration. We will start communicating more. We will hope to extend this working group. So those of you who represent some TCIM field could communicate with us. We want to work out standards for those who will practice this TCIM medicine. So everything would be conducted on a professional level. It is all possible. We may have to be patient. It may take time for the medical doctors to understand that this collaboration is necessary and useful. This is nothing new. We are only going back to the tradition that has been around for a long ages. We don't want to just criticize these fields. We want to have a healthy population to cure patients, and every patient should intentionally want to regain health and get rid of a risk of illness, and it is necessary to join forces. It is quite sad that I am an agriculturist by profession, not a medical doctor, but the professor who was here and represented homeopathy, Dr. Tichavsky, had a great saying that health starts in the field, and I do agree. We have to be responsible, take up responsibility for our own health, make sure that we stay healthy, and education for citizens in prevention and maintaining health is very important. So we will work on that. Please leave your contacts on a piece of paper that is running, that is being circulated here in the room.
Thank you so much for your response. And I have yet another question concerning complementary therapies. You talked about healthcare professionals, but complementary therapies can be carried out by people, by lay person, be it craniosacral therapy, homeopathy, or something else. And these disciplines, I mean, you don't have to be a doctor of medicine to carry out this. I mean, will it be only for doctors or not? I do represent healthcare professionals, but we know that in other countries, as Mrs. Laubstein mentioned, they've got the Heilpraktiker tradition, and in the Czech Republic, in Hradec Králové, there was an attempt to open a school that was closely focused on one complementary medicine discipline, but then it didn't happen. So we have a similar tradition as Germany, the Bismarck insurance, and natural medicine is traditional here. We've got healers who are well known, and the state should really pay attention to it to an extent to which a German state pays attention to it, and it should say this is safe, this cannot do any harm, it can only help. This is what we want, and the education should be different for healthcare professionals and for the others. And the very last question that I received is for our foreign guests. We have a question and sub-question. In your countries, how do the medicine doctors perceive the complementary methods we talked about? And the sub-question is, what is the most burning problem? How to break through the skepticism of the medicine doctors? how to break it through and how to start closer cooperation. Let's start with the lady.
Yeah, thank you for this question. The medical doctors in history has made big progress in complementary and traditional medicine. Dr. Hunicke, all the others, it's real famous. And now the situation has changed dramatically. And we have a battle inside the profession of doctors. The doctors fighting against doctors. So we have it in the homeopathic doctors, and the doctor assembly this year is they started a voting against homeopathy, and the voting has won. So the German homeopathic doctors now are under pressure and ask themselves what could be. And the situation is not legal, it's not based by law, but it has to do with the profession of doctors. And they have their own regulation committee. And this committee announced no more education in 13 of 16 regions and no more homeopathic work in the future for the doctors. So this is one. The others is the integrative medicine movement coming from the anthroposophical doctors, and they are mostly based in clinical hospital areas, and they want to bring in integrative oncology and all these things. But in my opinion, they started very strong with this initiative 10 or 15 years ago. And I'm not sure whether the skeptics are becoming more active since this integrative movement, they start this integrative medicine movement, or if the skeptics have done so. And last weekend we have been in Vienna, and there was a real doctors organization, it calls GAMED. It's a holistic medical doctors association, which are very strict in their idea that only doctors can work with traditional medicine. And Austria is really a poor country because they only have the possibility of energetics, and this is nothing to do with healing. But now inside this community of GAMED, they are fighting against each other. One is for integrative medicine, the others are for traditional and complementary medicine, and now in the university all the education is cut off, and the skeptics are on the run. And so inside the doctor's profession, it's big problem of the future. And I don't know what's about in Czechia, but we have the same situation growing up now in France. And I don't know where the way goes. So in this case, the hope for traditional and complementary medicine seems to be in other professions. I'm not sure.
As I mentioned before, in Italy, medical doctors claim the use of monopoly on TCIM. I think that as was in the beginning with Hippocratic medicine, there were three phases. The first one was IGEA, that is health promotion, lifestyles. Then Panacea, that are remedies. And then Ferro, that was surgery. And so gradually, conventional medicine, medical doctors, forgotten the first part, IGEA, and focused only on remedies and surgery. We are not here to, to go deeply into the detail of what are the reasons why they choose this, but this is the reality that we can see every day. And so there is a gap. And there are a lot of doctors, and we have in contacts in Italy now, there is a new association of medical doctors, very open-minded, that wants to cover this gap and collaborate with other professionals that are very good in doing health promotion. Because it's like a table with three legs, okay? Without one leg, the table can stay up. And so they are aware that we need collaboration. So now it's a very interesting period in Italy because there is the raising awareness of a part of medical doctors, especially after COVID. Many doctors with COVID raised awareness on health promotion, and they are still organizing in association to do this, to create this collaboration. Okay.
So in terms of the UK and in terms of statutory regulated health professionals' views of complementary and traditional medicine, I'd argue that actually most doctors, nurses, allied health professionals in the UK are accepting of the fact that some traditional complementary approaches are safe and are effective. Obviously, you're going to get a whole spread of opinions, but most, I would feel, would have that opinion. In terms of shifting the opinion, say, of the skeptics, because within the UK, like any country, there's health professionals who are skeptical that traditional or complementary health approaches are effective, or trying to shift the viewpoints of skeptical politicians, for that matter. For me, the key is rigorous, methodologically sound research. And I would draw the distinction there as well, because you've got to consider the hierarchy of evidence. Within, say, quantitative research, there's an established hierarchy of evidence, at the bottom of which is your laboratory research. Just above your laboratory research is your case studies. We've seen a number of case studies presented here today, and surveys of patients' opinions as well. In my view, that won't shift a skeptical, statutory regulated health professional, and it won't shift the views of politicians either. If you want to shift those perspectives, you need to be looking further up the hierarchy of evidence. You need to be able to show them systematic reviews, meta-analysis, meta-synthesis, showing that these are effective interventions. Do that, and you can shift the viewpoints.
Thank you.
Yeah, so in my view, we have a paradox. So on one hand, the homeopathic industry is no more in UK. Very sad to say that. My friend who just spoke before me, he showed you the photograph of his institution. That was a listed building in the United Kingdom. And the original title, which was carved in stone, said the Royal College? Royal College of Homeopathy. They covered that. They've done away with that. So now they're calling the Royal College of Integrated Medicine or whatever. So that's very sad news. Yeah, and Nora was sort of reflecting the same position in Germany. And this is, homeopathy is not from sort of Africa or Latin America or India, you know, where they think, oh, well, you know, these people, you know, they don't know what they're doing, you know. But the homeopathy is born in Germany. So what is wrong with that? Why do Europeans not accept that? And the other side, the good news is that we have now very many general practitioners in the United Kingdom and consultants in hospitals who have started embarking on something called social prescription. And that's something very exciting. So you have an issue, you go to see your doctor, and instead of the doctor giving you some medication, she or he might say, oh, have you been to see, you know, Rosemary upstairs? You know, she's doing some therapeutic massage. Or maybe give this patient access through. Is it that in a way is a beauty, you know, about this wonderful country that is United Kingdom, because our medications are free at source. So we don't pay the doctors any money. We don't pay anybody any money, it's all free. And so if you have a situation and the doctor thinks that maybe, you know, it's good that you should cycle to work, you get a cycle on prescription. And maybe that's something that, you know, we need to consider, you know, in this debate. Thank you.
Thank you so much. Prosím paní poslankyni, zakončí naši konferenci.
Deputy will finish and end our conference. As we could hear, the progress goes in waves. First, people trusted and supported, and then they turn back. It's a struggle we must not lose. Health is the goal and aim of all of us. Healthy people, healthy babies to be born, we won't give up. And I'd like to offer a conclusion of this conference. As I was listening to the speakers, especially to our foreign speakers, I'd like to say that we should go on creating a platform for serious communication of all fields of healthcare system. We must seek efficient methods of health interventions across all medical and non-medical fields, and want to include medical and non-medical professions, TCIM, CIM, into such new holistic healthcare, and provide for postgraduate education in all these fields. That should be our goal. And that should also be the conclusion of our conference. We usually thank at the end, so I want to thank once more to all our foreign speakers who have traveled to speak with us, inform us about the situation in their countries. Of course, I'd like to thank Mr. Tomáš Pfeiffer, because as Míla Rutová, who spoke here, said, we owe him a big thanks, not only to me for organizing this conference. And I think that we should also thank the current Ministry of Health and the Secretary for Postgraduate Education, Mrs. Řezničková, because she is one of us, if I may say so, one of ours. And what seemed at the start that it won't be very good, because when I first met Professor Fiala, who was appointed as the head of our working group by the ministry, I was very skeptic. In the end, it was clear that Professor Fiala is one of those people who are not afraid of traditional and complementary medicine, and the fact that he does acupuncture is only a cherry on the cake, but without him, I'm sure we wouldn't be able to proceed so fast. And because this includes most of us who are who struggle for time, I'd like to say that the outputs from our working group are progressing. We are streamlining our opinions, and the goals we set up 1 year ago are being fulfilled. And I hope to meet again in the working group at the end of September, and we will be preparing the next such conference where we want to make the next step towards general education, outreach, by inviting more patients and more medical doctors to provide us with experience about how this functions so well. We don't have figures and evidence for everything, but perhaps economic pressure on medicine will help us achieve better acceptance of TCIM and provide us with more opportunities to apply it. Because TCIM is, in fact, also quite cheap, and the people who practice it are honestly interested in patients, helping patients overcome some very adverse experience that they had at medical doctors, so to help them overcome tough facts and help their psychological condition as well. I came across many strong people in my life who are able to take well very adverse information about their health, but some people really need our help urgently, and we really need to provide holistic care to everyone, not only by providing patients with good news or bad news, but we must also take care of the mental condition of the patient, do everything for the patient to get cured. So the patients have the possibility to draw on all the wisdom mankind has. So I'll be happy to see more fighters in our struggle. Perhaps after 1 year, we will be happy to say that we wanted to make one step, but we have managed to make 3. Thank you for attention.
Předsálí je občerstvení, vy, kteří jste tady.
There is some refreshment in the hallway. Please help yourselves. And I hope that you like this conference, and I'll be happy to meet with you again. Thank you.